We're good. Okay. Good morning, everyone. And I wanted to wish everyone a happy new year. Hopefully, this year is going to be very productive and stress-free for everyone. Okay, let's get started with the roll. But before we start, I would like to inform everyone that board member Diane Prado resigned, and we will be working with DCA to fill her position as soon as possible. The board wishes to thank Ms. Prado for her invaluable service for the past 5 years. Jessica?
Ms. Pulowski,
Oh, I'm first. Here.
Dr. Bradbury,
Here.
Mr. Espinoza,
Here.
Dr. Grant,
Here.
Dr. Maniak,
Here.
Dr. Solocito.
Here.
Have a quorum.
All right, thank you. We would like to begin this meeting with a land acknowledgement to honor the indigenous peoples who have been displaced from their ancestral lands. This acknowledgement recognizes the culture, history, and ongoing contributions of the original caretakers of the land where we gather. Specifically, we acknowledge the Nisinan, Southern Maidu, Valley and Plains Miwok, and Patwin Winton peoples, as well as Sacramento's federally recognized tribe, the Wilton Rancheria. This statement reflects the Board of Veterinary Medicine's commitment to fostering inclusion and working collaboratively with these tribes on shared concerns. All right, so now we move on to agenda number 2, which is public comment on items not on the agenda. Before we open the floor for public comments on matters not listed on the agenda, I would like to remind the participants to refrain from discussing pending complaints, licensing applications, or disciplinary actions that may later require board decisions. Please note that this portion of the meeting is intended to allow individuals to share information with board members. It is not a forum for discussion or debate between the board members and the public. The only action the board may take during or after public comment is to listen and determine whether the topic should be included as a future agenda item. The board cannot discuss or act on matters raised during this section, except to consider adding them to a future agenda. So now we open to public comments. I believe, Jessica, you have something to share.
Yes, good morning, members. We did receive a written public comment that I'd like to read into the record. And this is from Steve Mayo. And it starts with, "Hi VMB, Jeff Olgwin was kind enough to respond to my voicemail regarding proposed changes to medical records 2032.3. A little background, my wife and I lost our beloved dog Bambi last March 22nd. She was almost 15 years old and we had adopted her when she was 9 weeks old. We have filed complaints against our vets with your department that we were told are being investigated. Bottom line, we were told one thing by our vets, but the written records of Bambi revealed a completely different scenario, along with numerous violations of your rules and regulations. We were never given those records, nor even informed they existed prior to our Bambi passing. It wasn't until our Bambi had passed away and I did lots of research that I discovered I could request Bambi's records. Had we had known before Bambi passed that we had the right to her records, our Bambi would have had a better chance at a longer life. But again, nobody ever told us those records existed or that we have a right as per your regulations to request them. So as a member of the public, we need to know that the records exist. It would be so simple to add a regulation that requires veterinarian practices to inform pet owners in writing that these records of our pets exist and that we as pet owners have the right to request them. It amazes me that this is not a requirement. If the public doesn't know these records exist, how can they ever request them? Knowledge is power. Why not give the public that knowledge? What can possibly be a problem with giving pet owners the simple information? As you can see by my signature line below, I'm a licensed California realtor for over 40 years. Our paperwork is tremendous, but we inform our clients that they have access to it all. If realtors can provide this information to the public when all we're doing is selling brick and mortar, Shouldn't your profession also inform the public when living, breathing creatures are involved? I would like someone from your rules and regulations section to read this and respond. Thank you, Steve Mayo.
Okay, so now we open the public comment for anybody in the room. Looks like there's no public comment. Moderator, could you please open it up for public comment online?
Absolutely. We are now taking public comment for items not on the agenda via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. Dial-in users will need to dial *3 to raise their hand. And for our mobile device users, you have 3 different screens and only one of them has a hand button, so you may need to hit the ellipses button, that's the ... in order to find your hand. People will be given 3 minutes to speak, and I'll give you warnings at 1 minute and another warning at 15 seconds before your time expires. First, we have Dr. Yom Tovian. Hold on just a moment, please. We're going to send you a request to unmute your microphone.
Hi, can you hear me?
Yes, go ahead, please.
Thank you, everyone. I'm so glad to be included in this meeting. My concern is regarding telehealth. I'm a veterinarian. I'm licensed in California. I was working with the Dutch platform for a brief period of time. I think this may be on your agenda. I just couldn't really understand the specifics of what you'll be discussing. My concern really is regarding the poor standard of care, the potential diversion, the excesses of medications being prescribed, really no oversight. I'm not sure who manages the telehealth rules. AVMA is pretty strict about what they view as good medicine and what is appropriate. And I'm seeing that I'm licensed in several states, that every state has different rules that deviate from the AVMA standards. I just saw a lot of bad things happening online. Animals waiting for medications, signalment wasn't really presented properly. Just a lot of what seemed to me, I've been practicing for a long time, pretty basic issues that maybe a newer doctor can't see based on the history. Yeah, I would love to discuss how we can make telehealth more appropriate for some of the things that people are calling in for, triage and maybe follow up and discussion, but not so much actually diagnosing things. Thank you. I hope that was succinct enough.
Thank you. Next, we're going to hear from Sarah Russ. I hope I'm saying that correctly as well. And that appears to be our last request. I've seen some hands go up and down, so if you would like to get in line, now is the time to raise those hands. All right, Sarah,
Okay, I believe that I am unmuted. Thank you.
you're ready.
Excellent, thank you. So my name is Sarah Roos. I am an equine internal medicine specialist as well as the president-elect of the American Association of Equine Practitioners. And I just wanted to call in support of California equine veterinarians. I've heard from several that they are being told that they cannot or should not be prescribing or dispensing products such as omeprazole without a confirmed gastroscopic examination. And certainly while scoping may be, gold standard to characterize disease, presumptive diagnosis and response to treatment are certainly well accepted means of diagnosis and treatment of gastric ulcers throughout the profession, including small animal and even human medicine. And so just wanted to go on record that due to the high prevalence of gastric ulcer disease across all disciplines, management schemes, breeds, types, et cetera, of horses, that any delayed response of institution of treatment in an animal with clinical signs is, in my opinion, a much more significant welfare concern than holding out for gold standard diagnostics when they may not be available for a variety of reasons. Thank you.
Thank you. All right. Next, we are going to hear from JC. This is potentially our last one, but again, I have seen hands go up and down, so if you mean for your hand to be up, please get it up. JC, are you with us? All right. Let's unmute you again. Hold on just a moment, please.
Hello, can you hear me?
Yes, go ahead, please.
Okay. We wanted to say thank you to the Veterinary Medical Board for taking the time to look into the animal chiropractic situation and consider the options that will allow the people of California to get access to animal chiropractic care with working with certified and trained chiropractors who are trained in animal chiropractic. We appreciate you guys taking the time to look into this and discussing this today. Thank you.
Thank you. And that was our last request for public comment.
Okay, thank you so much. Now we move on to agenda number 3, which is the review and approval of the October 16, 17, 2024 board meeting minutes.
And members, Ms. Pulaski sent in some suggested edits, and we can share that on the screen in just a moment so you can see it. And then if you have any other edits, please let us know and we can make them right now.
Dr. Bradbury?
Okay, so I just had one and I have to find it. It's on page 17, I believe. And it is under the heading closing remarks. I went back and listened to this just to make sure I was correct. The summary there, I think, is I would characterize it as incorrect. Listening to the closing remarks, instead of it saying, and based on her interaction with Dr. Paris, consumer protection could still be maintained with the proper guardrails in place. What I said was I had a little bit more of an open mind about it and looked forward to continued discussion. So I just wanted the record to reflect that I didn't definitively state that there was that consumer protection could still be maintained based on my interaction with Dr. Paris, but that I had a more open mind.
Would you like to suggest that so we strike starting with consumer protection and then what we would put in there to characterize that?
Sure. I would say, let's see here, strike. Based on my interaction with Dr. Paris, I had a little bit more of an open mind about it and looked forward to continued discussion. Or we could just say, and I had an open mind towards it and looked forward to continued discussion. And just to,
And look forward to continued discussions.
and I did listen to make sure that was accurate.
And then Justin, if you don't mind changing I to Dr. Bradbury. All right, thank you.
Anybody else? Any comments? Or
Or a motion?
a motion?
I move to accept the minutes as amended.
I'll second that.
I would like to open the agenda for public comment in the room. Okay, I see no comment. Okay, so can we open it up online, please, for public comment on agenda number 3?
We are open for public comment via WebEx for the meeting minutes and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. For our mobile device users, you may need to hit the ellipses button, that's the ... and cycle through the different pages in order to find your hand. And first, we're going to hear from Deb Zummerling. Hold on just a moment. We're going to send you a request to unmute your microphone.
Hello?
All right, go ahead, please.
Well, I apologize, but I had my hand raised and I didn't get called on the public comment section before. And I would like to, I really need to have a public comment on the use of Librela with animals in the state of California. You may not be able to control FDA, but it's clear that FDA rubber stamped this product coming into the country. Our animals are being used as guinea pigs to collect statistics on Librela and other for use in cats and dogs. My dog died after 3 injections with Librela. I have worked in the medical industry for years. Veterinarians, in order to receive this drug into their office, should have to sign off that they have read all of the adverse reactions. And for an owner to have their animal injected with Librela, they need to sign off that they have read the extensive adverse reaction list. In September 2024, over 22,000 animals had adverse reactions. In less than 2 months or 3 months later, that number is up to 24,158. The state of California needs to ban Librela coming into this state before more animals die. It is clear that FDA is collecting statistics going forward. My animal was not to be used as a guinea pig. She is gone forever. Thank you.
Thank you. And that was our only request for public comment.
All right, thank you. I guess now we move on to vote for the approval of the minutes.
Ms. Pulowski,
Yes.
Dr. Bradbury,
Yes.
Mr. Espinoza, Dr. Grant,
Yes.
Dr. Maniak,
Yes.
Dr. Solocito,
Yes.
motion carries.
All right, now moving on to agenda number 4, which would be report and update from the Department of Consumer Affairs. And we have Ms. Gear here, to do the presentation.
Can you hear me? Okay. Hello and good morning, President Solocito, Vice President Pulowski, Executive Officer Sieferman, and members of the board. Happy New Year. I haven't seen many of you since last year. I'm Melissa Gear, and I'm Deputy Director for Board and Bureau Relations, and I appreciate the opportunity to share the Department of Consumer Affairs update this morning. Before I get started, I would like to wish the board well with its sunset review hearings in the next few months, and to thank all of you for your continued service on the Veterinary Medical Board. I also want to thank Diane Prado for her service and commitment to protecting California's consumers and send her well wishes in her future endeavors. So, first update, Governor's 2025-26 proposed state budget. Governor Newsom released his proposed 2025-26 state budget on January 10th, which included 8 budget change proposals, or BCPs, for DCA's boards and bureaus. Additionally, DCA's vacancy reduction and government efficiency plans were approved by the Department of Finance and may be made official in the spring revisions. The governor remains committed to funding resources to address California's housing and homelessness crisis. Included in the governor's proposed budget is the creation of a dedicated California Housing and Homeless Agency. The Department of Consumer Affairs and other regulators currently under the Business and Consumer Services and Housing Agency would form a new consumer protection agency. This is an extraordinary opportunity for DCA to better align with other consumer protection entities as one consumer protection agency. With a Consumer Protection Agency Secretary within the Governor's Cabinet, this is an exciting opportunity that will only strengthen our mission, momentum, and delivery of services to California. The Governor's reorganization proposal will be reviewed by the nonpartisan Little Hoover Commission and the legislature in the spring. As more information is available, DCA will continue to keep board leadership updated. Form 700 filing changes effective January 1st, 2025. The Governor signed AB 1170, which requires board members to now file their Form 700s electronically with the Fair Political Practices Commission, or FPPC, using their electronic filing system. Effective January 1st, 2025, DCA board members must file Form 700s through the FPPC's online system. Filings will no longer be filed via the NetFile portal DCA board members have used for many years. Additionally, paper filings will not be accepted. The FPPC emailed all board members on January 2nd, 2025, with a link to the FPPC portal and login information. As a reminder, the annual Form 700 filing deadline is Tuesday, April 1st, 2025. Please contact Board and Bureau Relations with questions regarding the new requirements at memberrelations@dca.ca.gov. President's Training, February 19th, 2025. DCA invites presidents and vice presidents to attend our annual President's Training on February 19, 2025 from 10 a.m. to 12:30 p.m. This virtual training is for board members who are new to the role of president or vice president and those who have served in the role for a year or more. The training will review the role of a board president, communication best practices with the executive officer and board members, as well as the president's administrative duties. It also includes a panel of prior board members who will share their knowledge and expertise and answer questions from attendees. Learning from each other is a large part of this training, and we look forward to seeing all presidents and vice presidents there. Please register online using DCA's Learning Management System, or LMS. Board and Bureau Relations Team. Finally, I wanted to provide an update regarding DCA's Board and Bureau Relations team. Yvonne Durantes served as the Assistant Deputy Director of Board and Bureau Relations since October of 2022. On December 6th, the Governor appointed Yvonne as the Assistant Deputy Director of Legislative and Government Affairs at the California Governor's Office of Emergency Services. Yvonne's last day at DCA was December 31st. We appreciate Yvonne's dedication to the Board and Bureau Relations team, and we wish her well in her new role. And as I close, on behalf of the director, I would like to thank the board and staff for their hard work and partnership last year. We are excited about 2025 and the many opportunities that await us. Thank you for your dedicated service that protects California's consumers every day. I appreciate your time this morning and welcome any questions from the board.
Does anybody have any questions for Ms. Gear? I guess none. Thank you so much. Oh, we need, all right, we're now opening the floor for a public comment from the room. Is there anybody? I guess there's no public comment from the room, so moderator, could you please open it up online?
We are open for public comment via WebEx on agenda item 4. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. For our mobile device users, you may need to hit the ellipses button, that's the ... And for our dial-in viewers, our listeners, you may need to press *3 to raise your hand. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, please. All right, thank you so much, Ms. Gear. We're adding another item after agenda number 4. We will be having a report, a budget report.
Members, this is currently part of agenda item 24A, our administration report. We received a request from the budget office to be able to go right after the DCA report. And so we have Harmony online who will be providing that report to us.
Jessica, and good morning. My name is Harmony DiFilippo, and I am a budget manager with the DCA Budget Office. I would like to thank the board and executive staff for allowing me to present on agenda item 24A, which includes the board's expenditure projections and fund condition statement. First, I'm going to start with the board's expenditure projections, which were attachment 2 of the materials. These projections are based on actual data through fiscal month 5. This report includes 23-24 actuals in the green, as well as 24-25 budgeted and projected expenditures, which are in your blue and orange. As we move to the end of the document, you will see the board had a beginning base budget of $8.514 million and is projected to spend just over $8.131 million, creating a reversion to the board's fund of approximately $672,000 with a reversion percentage of 7.89%. The second document I will go over is the board's revenue projections, which is attachment 3 of the materials. This report includes receipts collected through November and projected revenue to year end. I will go further into the projections as we transition into the next slide. The next slide, attachment 4 of your materials, is the board's fund condition statement. As a reminder, we read this document from top to bottom and left to right. The left column is the board's prior year 23-24 actuals. It shows the board began 23-24 with a beginning balance of $8.26 million, collected $8.516 million in revenues, with $1.783 million from initial license fees, $6.133 million from license renewals, and $600,000 collected from the issuance of citations, fines, delinquent fees, and other revenue. The board expended $6.82 million, which includes $543,000 in direct draws to the fund for statewide pro rata and pension payments. The board ended 23-24 with a reserve balance of $9.884 million, or 14.3 months in reserve. For the current year, 24-25, the board projects revenues of just over $8.3 million, with 1.7 projected from initial license fees and approximately 6.2 from renewal fees and 364,000 from the issuance of citations, fines, delinquent fees, and other revenues. The board's 24-25 expenditures are currently based on the Budget Act with FM5 projections at about $8.31 million between authorized expenditures and direct draws to the fund, leaving the board with a fund balance of just over $9.8 million, or 12.5 months in reserve. The Budget Office will continue to monitor the board's revenue and expenditure projections and report back to the board monthly as we continue to close out the fiscal months in the current year. A few things to note about the board's fund condition. The fund condition is a snapshot in time. One of the main factors driving expenditure increases in future years is a result of personnel service adjustments. These include general salary increases as well as employee compensation and retirement rate adjustments. The Budget Office includes a conservative ongoing 3% increase to expenditures on the fund condition statement to account for these incremental adjustments. You will also notice revenue is static in the out years. The current year and budget year is still based on the 2024 Budget Act and will be updated with the 25-26 governor's budget at the next meeting. Lastly, I would like to note to the board that any future legislation or unanticipated events could result in the board's need for additional resources, which could create cost pressures on the fund. The Budget Office will continue to monitor the board's fund condition statement and keep an open line of communication with the board's executive staff for any future needs or expectations. This concludes my presentation. Again, thank you for allowing me to present at today's meeting, and I'll be happy to answer any questions you may have. Thank you.
Thank you, Harmony, and I apologize for not catching this earlier. I just wanted to clarify for the record on the fund condition attachment 4. It says prepared January 9th, 2024. That should be 2025, correct?
That is correct, Jessica.
you.
Thank you.
Dr. Bradbury.
Hi, thank you for your presentation. I just am wondering why we would have flat renewal fees for the coming years and not assume that there would be more since our population is growing and presumably our veterinarians, our veterinary population would also be growing. So I just wondered why that assumption is in place.
So the fund condition statement will show your prior actuals and current year estimates based on the fiscal month projections. And then budget year will be updated based on the governor's budget at the next meeting. But budget year +1 and those out years are going to be static based off of the projections for that budget year. And those are updated every fall through our processes and then presented after the release of the governor's budget on January 10th each year. So at the next board meeting, you'll see those projections starting with budget year 25, 26, and those out years will be updated.
Okay, thank you. I guess the reason that I'm even concerned about that is that we're talking about projecting out years from now when we're going into our sunset and discussing that we'll be needing to increase fees. So if we're using these numbers, I'm not sure if that's accurate or not, the projections that we're making.
So through that process, there's further discussions and around the revenues and potential increases. We just do not account for incremental revenue increases on the fund condition statement outside of the current year and budget year. So they're updated on a regular basis. If the board is going through potential discussions around fee increases, there'll be further review and analysis of those revenues that are collected and what those projected revenues might be for the future.
Thank you.
Yes.
I had a question, and that is on the income from surplus money investments. Oh, I'm sorry. No, sorry. Just get it. Sure. On the income from surplus money investments, it looks like there's a decrease from the 2023 or 23-24 actuals into the future, and why that is the case.
So the income investment surplus is based off of a calculation that's looking at the fund's balance, their beginning balance, also looking at what the expenditures are and the revenue comes in. So that formula is basically calculating based off of the numbers. So if you notice the decrease in that beginning balance, that plays a role, as well as the increase in that total expenditures. So it all calculates and then gives an estimate of what we expect that income revenue to be, but that as well is updated on an annual basis.
Thank you.
Yes.
Dr. Bradbury, I was looking at you funny and I apologize for that, but I feel like we've talked about that before and I was trying to remember what our response was last time because I had the same question when I looked at the revenues. So I apologize for that squinty eye look at you.
I was holding it against you.
I know.
Um,
I felt like I was looking at you like because I had the same question, but I felt like we'd already asked this question before. And so I was trying to determine what our response was last time and what we got as a response. So yeah, and if we determined it was better and we were even talking about was it better that we determined that it was like stayed the same. So
All right, any other comments from the board? All right, so we're now opening the floor for public comments in the room or regarding the budget report. I see no comments coming. So moderator, could you please open it up online for public comments regarding the budget report?
We are open for public comment on 24A. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, please. Okay, so we're now moving forward with agenda number 5, which is a report and update from California Department of Food and Agriculture. And I believe we have Dr. Annette Jones online to do the presentation. Good morning, Dr. Jones.
This is the moderator. Bear with us just one moment, please.
Thank you and good morning. Thanks for unmuting me. I'm going to see if I can share some slides. If I'm unsuccessful, I'll just give a quick verbal update. There we go. Is that, can you see that okay?
It's not showing up just yet. Hold on just a moment. Okay, down at the bottom, you should have a share button in the center.
Yep. Maybe I think I picked the wrong screen. There, how about that? Oops, wait a minute. Success?
Success.
Okay, great. Thanks. So I'm going to give a quick update of a couple things happening at the California Department of Food and Agriculture. The first one I want to talk just briefly about is an update on H5N1 or avian influenza and our response. It's a joint response with USDA and CDFA. And just for background, for those who aren't familiar, the virus did spill over into dairy cows in Texas about a year ago now. So we're learning a lot as we see this virus in a new species of cow. One of the things is that it definitely behaves differently in cows than in poultry. We're pretty familiar with how the virus behaves in poultry, unfortunately. In cows in general, there's a high morbidity rate, so it does seem to spread very readily from cow to cow, but the mortality rate is fairly low, especially if there's no comorbidity factors. And the cows do recover. Do they fully recover? That's yet to be determined. We're looking closely at that, but more to come on that. Poultry, very high mortality, so a different response. And our poultry response is based on a lot of data that's been gathered from around the world and actually pretty much shared and involved disease control response that most countries actually use, and especially all the states in the United States use. And it's a very rapid approach to try and reduce viral spread through euthanasia of infected flocks and control measures after that. So just a quick update on where we're at as far as dairy goes. This is through January 11th. And it goes back to when we first detected a cow in California towards the end of August of last year. At this point, we've had a cumulative total of 736 positive dairies. Now, if you go on the USDA website, you'll see a lower number. That's only because I'm including even our presumptive cases. So this is a very leaning forward current total of cows. Eventually, it'll be similar as the USDA website. We have, the good news is some of these dairies have cleared the virus, which means they've tested negative through a bulk milk tank test 3 weeks in a row. So 3 weeks of zero virus being detected in the herd. And so we've been able to release them from quarantine. And last week we surpassed our 100 herd mark of release of quarantine, primarily in some of the, in the southern Central Valley counties where the virus first started, is also where the dairies are recovering the most. And we do have over 100, close to 150 dairies in the process of moving through those 3 weeks of testing to hopefully be able to be released from quarantine. So we have a total of about 627 dairies still under quarantine. And when I say quarantine, that's state veterinarian quarantine, which has certain required actions to try and control the disease, like it limits animal movement, required biosecurity, required personal protection for employees. We do have every dairy under some form of surveillance now in the state. Once they're positive, we don't start testing them again on a weekly basis until they're getting ready to be released from quarantine, because we know their status. There's no point in continued testing unless they're one of our research herds. But all of the negative herds basically are tested. We have been testing them all once a week. And now we're testing, we're moving so that several of them we're testing twice a week, because when our epidemiologists ran the statistics, once every 2 weeks, the likelihood of detecting disease really doesn't change. We're also conducting biosecurity audits, conducting very in-depth epidemiologic interviews so that we can try and pull information together to understand where we are. This slide on the right, if you just look at the bars, you can cut the line is the cumulative total. The bars are the total of new cases by week. So it's basically the bars basically reflect an epidemiology curve. And you can see that we're on the downside of our epi curve. So the number of new detections is quite a bit lower now per week. In large part, that's because much of our California herd has been infected and is now developing immunity. There's a little bit of an artifact there at the end at the most recent week, because we did scale down on some of our testing over the Christmas and New Year's weeks, and we scaled back up last week. So you can see that little bump up on new detections. That's more of an artifact than actually any change in virus. We are definitely starting to move towards immunity across the state and fewer new detections. The workload on the surveillance is pretty heavy, though. We submit on a weekly basis about 1,400 samples to the laboratory in Davis, the California Animal Health and Food Safety Laboratory, as well as to 3 other out-of-state laboratories that are equally certified and accredited to run this test. Poultry update. This is our 3rd wave of this particular virus, H5N1, of this Eurasian strain that we've seen in our domestic poultry in California. Our first outbreak happened in 2022. And then we had a resurgence about a year ago. And then you can see those, if you look at those bars, the current outbreak has far surpassed the prior 2, which were progressively the 2 biggest of my 20-year career in this position. So the current outbreak is by far the largest the state has ever faced. And a big reason is, again, bird flu, H5N1, avian influenza, has evolved to be very comfortable in bird species. Poultry species in particular are very susceptible. And now these birds are at risk both from wild bird introductions as well as from dairy neighbors. And the Central Valley of California is just a beautifully rich agricultural landscape. The amount of food production there is really unbelievable if you spend any time out in the countryside. But with that goes dairies and poultry producers who live pretty close to each other, because they're taking advantage of all of the commodities that are produced in the Central Valley, the good weather, et cetera. So when dairy the virus load in dairies increases, inevitably, even with good biosecurity, the virus has somehow spilled over into the poultry producers. Obviously, cows aren't walking onto poultry farms, but the virus is. So we've had quite a few infections. Those bars on the far right, the orange, or I'm not sure how it shows up on your screen, the kind of orange yellowish, that reflects the number of cases that when we look at whole genome sequencing, it's most likely that the virus came from cows. So those are the cases related to cows. You could see in the previous outbreaks, they're all light blue because when you look at the whole genome sequencing, they are most likely if the virus came from wild birds. In this current outbreak, you can see our poultry flocks are kind of facing a double threat because they both have had a lot of virus introduced from cows, and then also quite a bit, just as usual, introduced from wild birds. And then the darker blue are those are the samples yet to be sequenced, so we don't really know what they reflect. Excuse me. We are making progress. When we have an infected poultry flock, we establish movement control areas. It's highly regulated. There's mandatory testing, required biosecurity. So we've established a total of 61 of those control areas. We've been able to release 33 of them because the virus has been controlled on the original farm, and the farms in the area have tested negative. So we're confident that that area is no longer at increased risk. We've also approved, once we euthanize a flock, and then we clean and disinfect the facility, and then there's surveillance that's done in the area or testing of the poultry flocks in the area. And the last thing we do is we do environmental sampling of the originally infected barns. And once those environmental samples come back negative, the owner can go ahead and restock and put new poultry on the premises. So 19 of the 61 commercial premises have been permitted to restock. The rest are undergoing, they're somewhere in that the process of that activity. So I mentioned how many test tubes we submit just for dairy testing, but we're also keeping our labs very busy with poultry testing. Just testing, remember I mentioned control areas and active surveillance so that we know the status of the uninfected flocks as well as infected flocks. So we submit, just last week, this is about typical for every week. We submitted about 1,200 tests for just routine surveillance. And then remember I mentioned environmental sampling. So we test the barns to make sure there's no virus. We submitted 165 of those. Of course, there's, if you have a big complex, there's a lot of tests for one complex that get submitted. And then before any, eggs or birds could move to harvest, they have to do testing to move. And we submitted just over 500 of those tests. And then if we have a suspect flock, like increased mortality, we rush those, we do those stat. And we just had one last week. It did turn out to be negative, although it looks like we may have one more this week that's positive. Just again, scale. I don't think everyone really appreciates the scale and the impact this virus is having. We hear a lot about pandemic and protecting employees, and we certainly appreciate that. We understand the One Health perspective, or big fans of a One Health perspective. But right now, this is having enormous impacts on agriculture. And just, again, scale. I don't think people appreciate it, but so last year it was the biggest outbreak of my career. It was very, very stressful and extremely depressing. And we lost, just looking at the different types of birds, last year's outbreak, we lost about 4 million chickens or layers. So those are birds that are intended to produce eggs for consumption. This year it's been 10.4 over the past 3 million laying hens that we've lost. The broilers, so broilers are birds intended to produce meat for consumption. Last outbreak, it was just over 1.5 million broilers that were lost due to this virus. This year, it's over 4.5 million. and turkeys, 100,000 last outbreak, over 500,000, close to 600,000 this time. Ducks, over 400,000 birds, ducks were lost in this outbreak. And last summer, or excuse me, last winter, it was about 248,000. And then we have lost some pheasants and checkers as well. So very, very big impact to our farmers and ranchers and our poultry in the state. We're doing a lot of research. That's the the problem with this virus in dairy is it's, you know, it's fascinating from a veterinarian and scientific perspective because it's very interesting scientifically, but it's difficult as a policymaker because we're trying to make policies to reduce spread, and we don't really understand the ecology of the virus in this new species. So while we're busy trying to mount emergency response, we're basically also coordinating emergency research, and we basically were able to redirect our antimicrobial use and stewardship team, who spend their days working with researchers looking at antimicrobial use and better ways to try and preserve these tools. So they've been just temporarily redirected to help with this. So we're doing a lot of, we're getting some preliminary results, which are helping inform policy, but basically there's close to, well, if you look both at the internal data analysis that we're doing as well as external formal research, we have close to 40 different streams of information coming in and different projects that are being managed, from looking at the disease itself to interventions, the environment, and then we have several others that aren't started yet, but they're kind of getting ready to be funded and started. So a lot of activity trying to better understand this virus. This is just example from one of the studies. One of the kind of neat studies is we're working with Colorado State, and UC Davis is doing something also kind of along these lines in one of the large dairy veterinary practices in the Central Valley. And they're doing a longitudinal study, collecting thousands of samples. They're trying to use a few techniques to find a dairy herd that is very early in infection, and then really trying to understand how the virus moves through the herd over the course of time. And this is just one example of some of their results in where they were able to find virus. So milk is by far the easiest and most convenient sample to take. The virus has a proclivity to the mammary gland, so that's where the sample of choice for surveillance of dairy herds. We use our bulk milk tank to detect virus. It's very sensitive. But nasal swabs, so for chickens, when we take respiratory or fecal swabs, get a lot of virus. But for cows, pretty much nothing in urine. And nasal swabs, not really productive. They've even used air sniffers and other techniques, and really difficult to collect any virus from the respiratory tract. Interestingly, they have found virus in serum, so that leads us to believe there's at least a transient stage when the animal's infected systemically. And the other kind of interesting thing is urine. In a couple of the herds, they were able to detect virus in urine. So these things are important because they help us, they give us hints for what to think about for spread of disease, because our normal biosecurity and trying to reduce movement of cows, it really hasn't made a huge dent in slowing the spread of disease. Almost, most of our dairies now have been infected by the virus, even with pretty extensive control, especially when you compare to other states. In California, we've taken stronger actions to try and stop the spread of the disease, yet we're still seeing a lot of spread. So I'll stop at the end if there's questions, if that's appropriate, but I just wanted to roll real quickly into another update. So Southern California fires are, certainly on a lot of our minds and in our hearts as we see what's happening down there. Just wanted to take this opportunity to provide a little background on some of the resources and how resources are coordinated to assist with animal needs during disasters. So emergency services function, the way that the state emergency response is organized is they kind of have different groups of agencies that focus on different functional needs. And emergency services function 11 is basically animals and agriculture. So that's where, from a big picture perspective and from a state level and regional perspective, there's groups of resources that are coordinated to try and meet those needs. Specifically at the state level, we have the California Animal Emergency Response Support. It used to be system. We changed it a little bit, CARES. If some of you have been around a while are familiar with that acronym. And that is where we, at a, again, big picture state level, try and work on preparedness and help to coordinate and move resources around to meet animal needs during disasters. Currently, the key through memorandums of understanding, MOUs, at the state level, that resource coordination is handled by CDFA and the Governor's Office of Emergency Services and the UC Davis Veterinary School. So we have an MOU, we have limited resources that are dedicated to training and coordinating, trying to get resources to where they're needed during a disaster. And then the last comment I want to make, because when we first started seeing the fires, there's a lot of people who, immediately want to, put state resources on it. But just as a reminder, all in our state, we believe all disasters are most appropriately left in the control of the community and the locals and local government, and so the cities and counties. And then we're organized as regions to support the cities and counties, and then as a state to move resources around. But basically, really, we do try and, as state agencies, we try and lean forward. We stay very engaged with the cities. We're contacting them all the time. We have some field assets that between the MOU partners that I just mentioned, UC Davis, CDFA, OES, we try and have people on the ground because sometimes there's chaos and it's difficult to get the needs from the actual, let's say, animal shelter that has a need all the way through the system to where the resources could be are coordinated. So we'll send some people on the ground to try and help speed that information, which we did do last weekend. UCD and a couple others had people on the ground providing that situational awareness to us. But basically, we don't want a lot of self-deployment. It's dangerous. It makes it difficult for our local first responders to do their job. We really want to try and respond to resource requests. So some of the things we're doing to do that, let's see. So vets and vet techs. Okay, so just a couple more background points and then my last slide. So veterinarians, as we all can imagine, are a critical resource oftentimes just after a natural disaster. So that when, let's just use a fire as an example, since that's what we're talking about. When the fire first starts, the priority of our first responding fire resources really is human health and safety. And we've done enough pre-planning so that sheltering and everything else includes animal needs. But pretty soon, in my experience in the cadence is, once the need for animal support grows about halfway through like right about now and over the next 2 weeks, I think we're going to really see the resource requests for animal needs start to go up. So we're trying to lean forward and be prepared, and we are starting to get those resource requests now. So vets and vet techs pretty much have always been and continue to be coordinated through the CVMA program, volunteer program, and then also through now, as of the past couple of years, UC Davis CVET was also funded to provide training, and they have resource lists. And these two entities work very closely together. Information sharing is very smooth between them. And that's our number one place we go when we need to bring veterinarians, when the local and the regional pre-planning for these resources is surpassed. We work through these two entities to bring veterinarians into the location needed. But we also need search and rescue, there's sheltering, there's animal control officers, there's a lot of other animal needs. And that's primarily coordinated through CDFA and OES and a lot of non-governmental, volunteer organizations or professional organizations like Cal Animals. So that's kind of the background on how resources on CDFA's role and our key partners' roles. So this is the last slide here, just some examples of what's happening right now related to the fires. So I already mentioned we've worked together as partners to have on-site situational awareness. Our CDFA has been pushing out a lot of social media, right? Targeting the CARES program has, targeting volunteers, like how can you be part of a volunteer situation where donations should go, where the shelters are. So we track and manage shelters, so we try and push that information out. And then because CDFA, we also have a very close relationship with the fairgrounds throughout the state. We are very actively engaged with fairgrounds that are providing sheltering for animals and making sure that we know the status of these fairgrounds and the capacity and how many animals are there. And then for the mutual aid request for animal control officers, that now goes through the emergency management mutual aid system. So CDFA helps facilitate that. We talk, technically we should be hearing from like the OES region or ESF 11 regional person, but we don't wait, because in chaos, you need to really lean forward and ask. So we're in constant communication with cities, counties, and shelters. Right now, I know the CARTs, or the community animal response teams, there looks like there's a growing need for them. So I believe we're working on a resource request right now for them as well. And then the non-governmental organizations or volunteer organizations have a coordinate. So most of the boots on the ground, if you haven't picked it up yet, most of the boots on the ground are all volunteers when it comes to animals. There's no, there's no CAL FIRE for animals, for example. It's volunteers. And what government employees do are actually help when the local agreements with these volunteer organizations are surpassed, we try and help bring in those additional resources. So that is it for my presentation, and I'm not sure if it's appropriate to take questions now or not.
Yes, thank you so much for your presentation, Dr. Jones. And for somebody who comes from Southern California, I would like to thank the CDFA for all the efforts that you've been putting in, helping those that have been affected by the fires. I just wanted to open the floor for the board members for any comments or questions. Dr. Grant?
Thank you. Thank you, Dr. Jones. Hope I'm on. I had a few questions. Sorry about that. Thank you for your presentation. I had a few questions. It seems like with the bird flu, with the dairy cattle and the birds, whatnot, that you have a heavy workload, let alone with the fires. And I'm just wondering how your staff is going. There's a lot of blood samples to take and analyze everything. Are you properly budgeted, or?
I appreciate that question because it's very kind because our staff are very tired. So I do appreciate that question. We are looking at, for emergency response, there's a lot of surge capacity built in. So we are able to add to staffing levels pretty quickly by tapping into, like for the bird flu, we tap heavily into USDA resources, and they, come in But we are looking at, are there some gaps that we should fill? That's yet to be determined, but
Thank
we
you.
are talking.
I had another question on the term lost. Those are birds that actually died, or they were euthanized, or?
Yeah, and I use that term purposefully because it's difficult to tell because they do, and when you watch a flock, the mortality really does kind of go through the roof, but we also euthanize the birds working with, different entities. And so we just have a total number that started and a total number that either died or were euthanized. You can't really tell which was which.
So the vast majority would be euthanized, or they would be dying on their own, or?
Yeah, probably because, especially if we're doing our job well, because, for example, we want to detect the virus really early so that we can keep the virus load in the environment low so that it reduces the likelihood of spread from poultry farm to poultry farm. So if we do our job really well, we detected it early and we can euthanize the rest of the, like, let's say there's a group of barns and they all have the same employees, the same equipment, they're close enough that the air circulation systems could suck virus from one to the other. We know if we waited a week, all would become infected. So if we've done our job really well, really just one barn is infected and the others were euthanized before they had any, significant virus load. So probably most of them were euthanized, again, because we've gotten good at working very quickly.
Okay, and then I was wondering about how you felt the role of wild bird migration played in the spread from dairy to dairy. I understand some of them would have lagoons they might land on at night or whatever, but the viral load in the feces is not great. Is that right? Or?
Yeah, excellent question. We're looking at that too. So the migratory birds, and we tend to find when we test migratory birds, it's carried in a lot of the waterfowl. So the migrating geese and swans and ducks naturally carry it. And that seems to be in the historically, when we pick up the virus in our poultry flocks, it's right when those birds are migrating. So we know they contribute. When it comes to cows, they're yet to detect the strain that they found in cows in these migrating birds again. So it seemed like there was one thing that happened in Texas, some recombination or mutation, but it wasn't picked back up into wild birds. So it doesn't seem like the strain we're finding in cows doesn't seem like it's going back to, just as an example, geese, and then back to poultry. All the evidence suggests that's not happening. But what we're curious about is, because we are detecting at very low levels in things like doves and starlings and pigeons that are closely intimate, on dairies. So we do wonder if maybe there's some local spread from those local birds, or is it dust, or is it flies, or is it, we're not sure, but there does seem to be something that's causing local spread, but it's probably not those migrating birds.
And then as far as the zoonosis or the carriers, are they farm workers themselves? Are they more predisposed if they have some inherent immune problem themselves? Are they more at risk for
That's
getting
probably,
clinical signs?
yeah, probably a question better asked, answered by the California Department of Public Health. I'm trying to think of some of the cases they've shared if there's comorbidity. I think sometimes there is, like the person back east that succumbed to the virus. I believe there are several comorbidity factors that contributed. The cases that we've seen in California has so far been, there's a few that their exposure isn't fully understood, but the ones where there seems to be pretty clear exposure, it's mostly been dairy workers and it's been conjunctivitis. And so the thought there is they're supposed to be wearing their glasses, but an employee, they'll put them up on the top of the head, or they'll just not paying attention and they rub their eyes or something. So it's been primarily conjunctivitis in our dairy workers.
And so are the dairy workers, do they have special clothing they wear when they're around the cattle and take it off before they go to town for lunch or something, or?
Yeah, and that's something the state worked together. So CDFA and CDPH, the Ag and Health, we started working together before we even had our first case in dairy to come up with a plan and how we would share information and how we would ensure our employees are protected. And Cal OSHA, of course, is a part of that as well. And the ahead of infection, the health department and local public health departments made personal protection equipment for free, readily available to dairies and poultry farms so that they could stockpile basically eye protection, N95 masks. I think they had gloves too. And then, so those are the kind of the key protective equipment that employees wear. So they had that before infection. And then as soon as we suspect a herd or a flock could be positive, we provide that information to public health, and public health talks to local health, and they reach out to the farm to make sure that their employees are being protected and to monitor. And they also monitor for any cases.
Thank you.
Dr. Jones, I have a question. I know the focus of the CDFA is more for our food and agriculture, like animals. I guess the question that I have is with regards to the impact that H5 has impacted the pet population. I was wondering which agencies should this board be working with, in making sure that we're at least providing information to the pet owning population. And also in your report, you mentioned about milk being the easiest to transport the virus, to carry the virus. And we know that we've seen reports where raw milk has been a source of infection in cats, I believe in Southern California. So what is the status of action taken by agencies that is in place right now so that we would make sure that we have some sort of control and also providing the public information?
Yeah, I'm so glad you asked that question because it reminded me of two things. One, I don't think I said it because I assumed everyone knew it because the messaging has been out, but pasteurization has been proven to 100% inactivate or kill the virus. So pasteurized milk, first of all, part of our quarantine is to separate sick cows from non-sick cows, and only healthy cows provide milk, for our milk stream. The problem is there's this long asymptomatic period. So it is possible that a cow that looks healthy is being milked and the milk is going into the food supply. And pasteurization that's why we pasteurize. It kills the virus and absolutely kills the virus. So there's zero food safety concern for pasteurized products. But as you mentioned, raw milk products, there are some issues there. And so what we have done, especially that's the other thing I didn't mention, it does seem that cats, and like large cats and domestic cats, are uniquely susceptible to this strain of the virus. We've seen several cases. So for raw milk, we test weekly. Now, a lot of milk moves between tests if we test weekly. And so in an early infection, and I believe this is what happened with one of our raw milk dairies, there was kind of some are they in, we didn't, there might have been one cow, two cows. So on our test, it was negative. But there was probably early infection. So what we've done is on our large raw milk dairies, if they're positive, all of their milk has to be diverted to pasteurization. It can no longer be sold raw. So that that's always been in place since the beginning. But what we've also done is increase the frequency of testing of especially dairies that are in that highly infected zone, so they're higher risk. And so we test them more frequently to make sure we're confident that their milk is negative. But the other thing that's come up is raw pet food. And that is an area where we could probably do some communication and communicating with veterinarians on the safety for raw pet food. And I would defer to the, vet med board and others on, pros and cons on raw food in and of itself. That's not an area I have that's not an area of my expertise. But I would say the raw companies CDFA does regulate raw pet food. And if you're selling what that has historically meant is we look at the products, the raw side going into pet food that's processed. So usually CDFA, our meat inspection program, approves the source of raw meat that then is cooked or canned or processed, and the Department of Public Health regulates the canning piece of it or the drying piece or however it's treated. With this trend of selling raw food to be consumed raw, CDFA just a couple of years ago looked at our authorities and realized, well, we need to regulate that because we take the raw. So if they're selling it, so we started registering these companies that sell raw, and then we look at the labels, we look at their input, we can provide more oversight. The companies that were selling raw food in Los Angeles associated with some of the cat deaths were not registered with us. So we had not been providing that kind of oversight. I don't think it was malicious. I think it was a matter of we needed to probably do more outreach. And they're working with us proactively now to become licensed. But probably that is a message that private veterinarians it would be good to, when they're talking to their clients about whether raw food's good or bad, it's up to, I don't know that, but I definitely know they should say, make sure if you do feed raw food that it comes from a licensed pet food provider, licensed by CDFA.
Thank you so much for that. Anybody else? Dr. Bradbury.
Good morning, Dr. Jones. Thank you so much for coming and providing this update. Also, for all of your hard work, and that just really, it sounds horrific what you and all of your team have been experiencing, and my heart goes out to you guys. It's that doesn't sound like a fun job, but I am so appreciative of what you're doing. I also had a question about the raw diets, and I am glad to hear that there is somebody that is looking at raw diets and regulating them. I wasn't sure who did that. I know that some of the larger captive cat, the large, exotic cats that are captive, and then also some pet cats in other states have contracted the virus through consumption of raw meat and raw foods. So are we testing the like raw chicken, turkey, duck diets for the virus at this point?
Well, the goal is we shouldn't have to, because that meat should never have gotten into the food supply. So that's really the focus, is even moving the prevention up further. So I know, so for the big cats, a lot of the investigation there, and we do have 2 groups of big cats in California that were, they lost, I think one, they may not have lost the cats, they were just sick. And the other one, they did lose a couple cats. We haven't really traced the food source there, but I know the ones at Washington, it looks a lot like it came from turkeys in another state. When they look at the whole genome sequencing. So one of the things that USDA just recently did is there's concern that when a flock is in an early detection phase, so they're either slow to report increased mortality, or they think it's increased mortality from a disease that the flock also has. So they're not doing the proactive testing that maybe they should be, and they don't have antibody, because usually the pre-slaughter test is an antibody test. So maybe they haven't converted antibodies yet, so that's negative. So there's this really small window that it looked like there could be some positive flocks, especially in some of the states with high exposure to wild birds. So in Minnesota, North Dakota, those states, that they were slipping through, and that is where some of the source for those big cats are. We cook our meat, so even if it had slipped through for human consumption, or maybe there's more inspection, maybe, for human consumption. But so that USDA recognized that could be a gap, so they just started a proactive PCR test of those flocks in those higher risk areas. So the goal is just to keep it out. We're doing a good job keeping it out of the human food supply, but we just came to our attention that, wait a minute, these big cats, they're getting food somewhere, and apparently that's where. So we're trying to close that gap too.
Great, thank you. The other question I had was sort of related to Dr. Solicito. So we know that pet cats have been shown to be susceptible, and then there's also a lot of wildlife outside of birds. It's, I think, the first time that it's spilled over into carnivores. If we have veterinarians that are seeing these cases, who do they report it to, since it's not the CDFA?
Yeah, so I didn't mention it. I mentioned that we've been working really closely with public health, but we also work really closely with Fish and Wildlife. So it's really those three agencies that work. We share information readily between each other, and we talk to each other a lot. So I believe most of those probably would be Fish and Wildlife, to the veterinarians who work for Fish and Wildlife, where those reports need to get made. But if a veterinarian is seeing concerns in captive wildlife, for example, they also tend to work a lot with those. Captive wildlife works a lot with USDA animal care also. So it doesn't really matter who they report it to, CDPH, they're public health veterinarians, CDFA, state veterinarian, Fish and Wildlife. We will get it to where it needs to go.
Great. And then just finally, I wanted just to commend your hotline that you guys have. I found a rooster just after Thanksgiving, and it was a Sunday night, and I had questions about sort of symptoms in birds, since I am not a poultry vet. And I called your hotline, and somebody actually answered it at 10:30 at night on a Sunday night. So thank you so much for providing that. And again, for all of your hard work.
Yeah, thanks. I know who that is, so I'll pass it along.
Okay, Dr. Maniak.
Hi, Dr. Jones. Thank you again. I second all the comments from my work your team has been doing. One question is, I don't know if it's in the stage of theory, but does it appear that the bovine version is a mutated form of the avian, or is it just we don't know enough yet about the virus to know whether this is how it's transmitted amongst birds versus bovine?
Yeah, well, I'm not a generalist, so I'm not a genetic expert, but I can say when they do the whole genome sequencing, it is on a very distinct, in a very distinct group in a distinct tree. So it's very easily to distinguish this strain that I keep saying just for shorthand associated with cows, bovine strain. It's not really a bovine strain, but it's very distinct from the other types of viruses. So it did change somehow.
Got it. Thank you so much.
Okay, let's move on to public comment with regards to the CDFA report. in the room? I don't see anybody raising their hands. So moderator, can you please ask folks online if they have any questions or comments?
Absolutely. We are open for public comment via WebEx. If you'd like to make a comment on the CDFA report, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And as a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, please. Thank you. Dr. Bradbury has a comment.
Sorry. I just wondered, is there anything else that we can do to help help you guys?
Oh, I have to think about that a little bit. I mean, we do, the nice thing is we have a very good dialogue now over the past couple of years between the Vet Med Board and CDFA. And so I think as those things come up, we're pretty good at it. Mostly it's outreach and communication. And I think we're doing okay there.
That's great. Thank you so much, Dr. Jones. Thank you for your report and for your all the information that you've shared with us.
Okay, it looks like someone has their hand up. Anna Stiles.
Moderator, is there somebody online that is?
Anna Stiles, your student liaison, has the ability to unmute at will.
Perfect. I did not know that. Can you hear me okay?
Go ahead, please.
Okay. Excuse me. So I just wanted to kind of add here that obviously as a student here at Western U in Southern California, even though we are not in a immediate zone near the fires that are happening, we're definitely affected. I know several classmates who have had to evacuate just as the semester started last week. And I'm interested whether it's from the representative at the CDFA or any other agency, like students here, even while in vet school, really want to help somehow in this situation. And so I'm interested in hearing how UC Davis Vet School is involved in emergency responses like this, and how Western U can become engaged in those kinds of things in a more organized manner, because our students have been kind of doing things more on an individual level, but I think it would be great to have Western U included alongside UC Davis Vet School, because obviously, these wildfires are happening down here now, but we know due to climate change that these things are getting worse and more frequent, and so having kind of Northern and Southern Californian vet students involved, it helps us when we really want to get involved and help our community in times like this.
I'm going to give a short answer and then we can follow up for more details. So the short answer, for anyone's benefit who's listening in, the best thing is everybody wants to help. So nobody should just show up though, because then it's an unsafe situation and there's more chaos. So the best thing is to ahead of try and engage locally. So when I mentioned UC Davis before, that's more of a coordination level, not necessarily a first response level. For their actual first response, they're part of what I mentioned, the community carts, and they have insurance, they're sanctioned, they're part of the response. So, and you can reach out later, or you could look at our website to find more information on that, or you could Google cart animal and you'll get more information on that. But that's the best thing, is try and start to organize locally first with your city's animal control cities and counties as a resource. That's the best way to start.
And I believe we have Dr. Grant here Dr. Miller to give us more information on how vets and vet technicians and vet students can actually help.
Yeah, thank you. And this is Anna, thank you very much for your comments on being involved. My name is Grant Miller. I am, I guess with this hat, the state coordinator for the California Veterinary Medical Reserve Corps. We are the largest volunteer organization of veterinarians and technicians in the country with over 3,000 members. We are currently actually deployed to the fires, but in more of an administrative capacity. They're asking us for some organizational support in their emergency operations centers. But I do anticipate that we will deploy what we call boots on the ground people in the coming couple of weeks. Anna, to answer your question specifically, in addition to what Dr. Jones mentioned with being involved in your carts locally, I would encourage you to also become a registered member of the California Veterinary Medical Reserve Corps. It's free, and volunteering and deploying is only if you're able to. It's open to students, and in fact, Dr. Diane McClure, who's one of your faculty members, is one of our deputy coordinators for the MRC, so she's a great resource to you and to other students if you'd like to learn more about the MRC. I'm also happy to come speak to the school, which I have done before, about the Medical Reserve Corps and how students can be involved. UC Davis's involvement at this point, though, with their disaster team does not involve students at all. The UC Davis CVET team is a disaster response team that is funded by the state of California. And they provide, like Dr. Jones mentioned, they provide a lot of coordination and logistical support. So I don't want you to think that, you know, the UC Davis students are out there responding and Western is not. That's actually not the case. But if there was a coordinated response through the CAVMRC, students would be welcome to participate in that in the extent that they could. So I encourage you to register. You can go to cavmrc.net for the registration form. You can tell your other students, and Dr. McClure is also available to you if you have additional questions. Thank you.
All right. Thank you, everyone. I guess that's the end of the public comment online. Oh,
Yes,
okay.
indeed.
So do we have anybody else online that's raising their hand, moderator?
There is no one else online looking for public comment at this time.
Okay, thank you. I guess at this point, we will be taking a 10-minute break, and we'll see you in 10 minutes. I guess we're back in session. We'll start with agenda number 6 for the review, discussion, and possible action on the MDC committee report. Dr. Richard Sullivan.
Good morning. Okay, I'm going to preface this by some of the material that I will be presenting will be abbreviated. Others, I think we're going to need to go into some depth on. So apologies for the abbreviations. We have staff and MDC members on this board. So if I'm missing something or misinterpreting, let me know, because we've got a lot of material. And I realized last night that my pages don't correlate with yours, so we'll have to work through that. Okay, we had a call of the meeting called to order at 10 a.m. Roll call followed a moment of reflection of the people and animals caught in the fires of Los Angeles. There were no public comments on items not on the agenda. The minutes of the October 15th, 2024 MDC meeting were approved as amended. Now I'm just going to summarize the agenda items that we're not working with today. So we'll get those out of the way right at the beginning here. The agenda item 8 was a complaint audit subcommittee. report was given by Dr. Getkin and Waterhouse. Their report is in your packet, and they summarized, number one, a consultants roundtable on November 20th, 2024, with a chart of the number of cases the consultants the number of cases that the consultants reviewed in 2023 and 2024. This roundtable discussion allows the consultants to discuss different topics that they run into and how best to deal with them. And again, on your packet, that goes into more details of those items. The second item was the quarterly expert roundtable on November 22nd. This was with the consultants and the SMEs. Again, there was discussion about topics and how to handle cases and what are the best practices. The board's Deputy Attorney General Liaison was also present and always provides great information leading up to the hearing and points on how to key components to testifying. Another chart was included showing the SME activities for the years 2023 and 24. The subcommittee gave a report on their case reviews on finalized cases and developed a list of topics to discuss with the experts. The subcommittee met on December 9th, 2024 to discuss updating the complaint form to better triage submitted complaints, including the prioritization of the complaints. After a lengthy discussion into the potential options, the subcommittee determined that the statutory change may be necessary to better prioritize complaints. It appears that the subcommittee will be bringing forward some legislative recommendations in the near future. Agenda item 9 is the outreach subcommittee. They met with a couple of professors at the UC Davis School of Veterinary Medicine and were updated on what the school is doing to teach the difference between spectrum of care and the gold standard, and under what conditions the spectrum of care should be used. They also listened to the unlicensed practice stakeholders meeting and appreciated the suggested outreach activities that were discussed at those meetings. Several of those ideas were already in the works. They did feel that those stakeholder meetings were very productive. The California Department of Food Ag Subcommittee gave a report, and I am going to say that most of that was already covered today. So we will bypass that. The most important agenda item was agenda item 11, election of 2025 officers. Ms. Marie Ussery was elected chair, and Dr. Cheryl Waterhouse was elected vice chair. So any questions or comments on that part? Okay. So I don't know exactly how you're going to want to do these. I'm going to start in an order, and if it's out of your order, let me know and we can switch around. But I've got about 3 documents I have to use here. So the first item that I have is your agenda item B. And I believe this is correct. Update discussion and potential recommendations from the executive committee. Is that correct? Proposed legislation to repeal Business and Professions Code sections 4838, 4846.5, and add Article 3.1, which is sections 4858, 4858.1, 4858.2, and 4858.3 regarding continuing education. Okay. BPC section 4038 allows the board to require RVTs to obtain 20 units of CE credit to renew their license after their second and subsequent renewals in the field of animal health technology by pursuing one or more courses of study satisfactory to the board or by other means deemed equivalent by the board. During the July 2024 board meeting, CVMA requested that the board amend CCR sections 2086.4 to allow 2 CE units of their required 20 units every 2 years to be earned by participating in pro bono spay and neuter services within a qualified program similar to what a veterinarian can earn pursuant to BPC section 4846.5 subsection B2 capital B, as noted at the bottom of page 1 of that memorandum. Board staff and councils met with the CVMA to discuss this in September 2024. The board councils determined that the statute likely should be amended to clarify the board's ability to authorize CE credit for the performance of pro bono animal health care tasks associated with spay and neuter services, and to clean up problematic language such as, and I quote, appropriately equipped and staffed, unquote, and I quote, demonstrated financial need, unquote. There are 2 statutes and 24 regulations related to CE, most of which are duplicated for veterinarians and RVTs. In addition, the statutory structure for veterinarians and RVT CE requirements are vastly different. It was determined that the entire section, both in statutes and regs, should be removed, cleaned up, and clarified in one section as a legislative proposal to be presented in the Sunset Review package. As such, the subcommittee recommends repealing the 2 current CE-related statutes, BPC sections 4838 and 4846.5, and adding 4 new statutes, which mostly mirror and or combine existing laws under 1 new article in the Business and Professions Code. If and when this legislative proposal becomes effective, a Section 100 rulemaking package may be submitted to repeal most of the CE related regulations. So it looks big and bulky, but it's pretty straightforward. The substantive policy changes in the attached legislative proposal are highlighted in yellow and are: 1, adding the ability of an RVT to earn up to 2 CE hours for performing pro bono animal health care tasks related to spay and neuter services. And 2, adding the ability for RVTs to earn up to 16 hours for participating in as an expert in an examination preparation workshop for the national licensing exam. That has later been amended, and we'll get to that. All other changes are intended for cleanup purposes only. The first action is to repeal all of BPC sections 4838 and sections 4846.5, and then add a new article 3.1, continuing education, with the new sections 4058, 4058.1, 4858.2, and 4858.3, all in one section, so it's all together. The rationale for each proposed amendment is provided in italicized brackets. This is included for informational purposes only and is not considered part of the legislative proposal to be submitted to the California State Legislature. Now we can start with the legislative proposal. And on the memorandum that we had, it was on page 5. I'm not exactly sure where it is on yours.
We'll actually pull up the version that the MDC edited yesterday so everybody can see the proposed amendments. It was also emailed to the members yesterday as well.
Okay. I'm going to highlight only those sections that are added or need to be clarified. And don't hesitate to call me out if something isn't clear. Let's see here. So we start, and I think I have your copy. We started with the new pages 1, 2, 3 in the top of 4, which is sections 4838 and 4846.5, which we are repealing. That's the easy part. Starting in the middle of page 4 is new Article 3.1, continuing education. And this is with section 4858 with the italicized brackets to let you know where the language came from. The MDC made no changes in this language. On the next page is the new BPC section 4858.1. Number 1, the MDC removed the original text in subsection B, and I quote, notwithstanding any other law, which now reads, continuing education hours for veterinarians shall be earned as follows. 2, they did the same with B number 2 as you have in red in your most recent copy. I'm going to jump up a little bit. I would also like to point out in subsection B1 capital B that we are allowing for affinity specialty associations. Number 4, in subsection B2 large B, we removed, and I quote, the services shall be provided to a household with a demonstrated financial need for reduced cost services, unquote. Number 5, in subsection B2, large B, Roman numeral 1, we have replaced, and I quote, the services shall be administered at a facility that is appropriately equipped and staffed to provide those services, unquote, with, and I quote, the services shall be performed at a, and we've crossed out facility and mobile unit that is, and replaced that with veterinary premises, registered with the board pursuant to section 4853. You have that all on your screen, right? Okay. On page 6, the next page is the next subsection, Roman numeral 2 is highlighted in yellow and is new and clarifies what constitutes proof of completion. And number 7, and in subsection number 5, on the same page, I think it is, it begins with, for purposes of paragraph 1, that's what's added, up to 24 hours of continuing education credit may be earned for completing courses in business practice management of, or, and we cross out stress, and we've replaced that with licensees' mental health and wellness and its impact on the delivery of veterinary services. I think we should stop there. And
So just to clarify, there's a couple additional changes. So in for the highlighted section, it did say up to 16 hours of continuing education credit for the examination prep. The MDC requested that be changed to 9 hours. For paragraph 5, it did say 15 hours of continuing education may be earned for completing courses in business practice management. We changed that. The MDC had changed that to up to, I just lost it, 13 hours. Thank you. And then also instead of saying, I thought we took out the term licensee, and I thought it was just mental health and wellness.
oh, I'm sorry.
Oh, sorry. We were on the wrong page on the screen. My bad. I'm sorry. Continue.
I'm sorry. I'm finding this really confusing, and I don't think we can do anything about it this time, but these are really important long proposals that we're talking about for statutes, and I like, when we're reading through these at home, we like save them and then take notes on them, and then we try and open them up and read through them, and we end up with all of these different documents, and I find it really hard to follow on these screens. So there's nothing we can do about it here, but I just hope that we can figure out a way to be able to have these documents in a way that we can all follow along on our own computers in the future. That would be really, I don't know how to, we can maybe brainstorm, but like I can't follow where my notes are because it's the MDC notes because it links you to the MDC notes, and then those have been changed. And this doesn't even seem to match the thing that was sent to us last night.
It does. I apologize. I think the confusion is, I think on the screen is actually ahead of where Dr. Sullivan was.
Right.
So what you received last night is correct, but if Justin, if you can scroll up, because you're right now in the RVT section, but Dr. Sullivan was referring to the veterinarian section. So you got a little ahead of us on that.
We're only on the first highlighted section.
Okay, so we are on, for the document that was sent to us last night, just so I know that I can follow along. We are on page, there aren't pages on there, so.
I think it's page 6 of what you got last night and what Justin can display. That's the end of the veterinarian CE requirement section.
Okay.
Still under 4858.1. So
Right.
you're on
48.
2,
You.
and it's 2, and then you're going to be, it's basically 2, but it's on the top of the next page.
Yeah, so, well, I have 2 and proof of completion, which is highlighted.
Correct. The first highlighted,
Yep.
yes.
Okay,
Yes.
thank
Sorry,
you.
that was the screen we got lost.
It's all good.
Okay. So you have a copy of what was sent?
We got, yeah, I do.
Okay. Because that's what we need to work off of.
Maybe we just finish the veterinary part and
Yeah,
finish that page, and then
No, what
that's
we
where
have-
you were, but I don't
what
think the
we have
screen was.
finished is for, yes. We are finished with 48.
I feel like Dr. Sullivan needs that screen
We are,
because he's working off of a different document.
no, I've got it right here. I've got the same one
Okay.
you have. I just have to refresh myself on, so we are, yeah, 48, we are finished with 4851.1. Okay, that's the veterinarian part. So I think we should open it up for discussion and make sure everybody is straight on what we've done.
Okay, Dr. Bradbury.
Yeah, so I just had some thoughts when I was reading over this. In addition to the antimicrobial, judicious use of antimicrobials that we have as a requirement, I was just wondering if we wanted to think about adding the California law exam, or, you know, what we provide for people that are applying for California licensing every 10 years, so that our licensees are able to stay up to date on new rules and regulations. So I just thought this might be a time where we could do something like that. Didn't know how people felt about that. And then additionally, I think that the lack of engagement of veterinarians in board meetings and what we're doing leads to a lot of misunderstanding. And I wondered if we could add attendance at a board meeting up to 2 hours towards their 36 hours as another option for CE credit.
I think, my understanding is that there are still going to be some regulations remaining. And I think that the legal requirement or the law requirement would probably be there. That's where it is now, isn't it?
I think she's referring to making a renewal requirement
Oh,
that they take the law exam every 10 years, correct?
okay. I'm sorry, misunderstood.
Yeah. So that's up to the board to discuss, and if that's what you want to request.
And it would count towards, I guess, 1 credit towards CE. It's just a thought.
Is 10 years I mean, to me, that seems like a long time.
Our regulations take like 4 years to get through. So I thought maybe, I originally thought like 8 years, but then I thought, well, maybe a more of an even decade. Yeah, I'd be open to something shorter, but since we're not in part of the MDC meetings and the discussions on these, it's hard to bring, I only thought of it at the end and should have probably mentioned it to somebody, but
So you're suggesting a requirement of everyone taking the law exam once every 10 years?
yeah, it's something that we provide, and it's, I think, you take it is, you take it until you pass kind of an exam, right? I mean, it's a online, like presentation, and then at the end, is that, I don't even know how it works right now.
I think there's a difference between requiring completion, successful completion of the law exam once every 10 years. That would need to be under the licensing statute. This is continuing education. So if the concept is to allow CE credit for successful completion of the law exam once every 10 years, that could be added here. But
I
there's
guess-
two different concepts.
I guess my question is, what is being provided out there for continuing education to keep veterinarians in California apprised of changes or of anything new with regards to legislation? So I guess if it's going to be a continuing education, it would be easier to say, just like the antimicrobial, CEs that were requiring them to have, maybe that would be something that we could require, is to also try to do a jurisprudence update. However, the question is, what is being provided out there? Who's providing those continuing education opportunities?
We are.
So I guess that's something that, is the board going to take that on as a responsibility for us to be providing all of these updates on a regular basis so that it's going to be available for our constituents? Christy?
Yeah, I think now we're saying that we're requiring this in order for renewal, when we're just talking about continuing education. So I think that we're changing the meaning of this document. Instead of saying this is how you're getting continuing education and these are options for you. I see what you're saying. I like the idea of attending a board meeting is an option for getting continuing education. That's an option for you. That's another way, because it's encouraging people. So I like that aspect, but saying now that you have to do a law thing in order to get your renewal or a certain amount of time. I think that's different. That's changing this document completely.
However, I'm sorry, I mean, we have a requirement in CE for the antimicrobials, so it's the same thing.
Right, but it's, and I understand, and I just think that it's changing the intent of this document of where we were going. So I think that we need to get more input, right? I mean, I get it and I understand it, but
I really like the idea of identifying, like areas for continuing education, because I'm sure there's a lot of folks who, for the lack of real interest in the continuing education part, would just go to whatever and whoever is providing CEs just to check it off their list, right? But if we're actually giving them some guidance on of their participation actually in the development of the profession, because I as I was sharing with Dr. Bradbury, one of the things that I realized is that how disconnected a lot of the veterinarians are with the board, with what we're doing, with other with CVMA. It's because they're not engaged. Maybe this is an opportunity to develop engagement. So for that intent, I appreciate that. However, the question is the how.
So I think a couple things. This was agendized for, oh, go ahead.
Dr. Grant?
Yeah, do we have to, can a motion be entertained to add Dr. Bradbury's suggestion at this time, or does it have to come up for a public discussion? Is it a new item put in here?
So
I'm in favor of trying to streamline it for sure. I think it'd be good to have them all together, be awfully nice, because it does get confusing, and I certainly think that encouraging CE credit for attending, but is that a Zoom attendance as well? That would be good.
So you could do we're talking about two different things. We're talking about continuing education credits, and then we're talking about adding a renewal requirement, which the renewal requirement itself hasn't necessarily been agendized. So I think that idea might we need to come back to a future meeting. But if you want to look at adding other continuing education opportunities like attending a board meeting, you could put that in now if you would like. I don't have language in front of me. I know other boards do have similar abilities for them to earn continuing education credit. I don't know, Tara, if you know of a board that we could look at, but if you want us to craft it right now, it might take a minute.
I would just like to try and add it to this legislative proposal. So I'm not in any hurry. I want it to be done right, since it would be, but, and then I'm happy to look at the other thing at another time.
Okay, and you said up to 2 hours to attend a board meeting, so it'd be 2 hours per renewal cycle?
That was a suggestion. I'm open to other ideas, whether more should be acceptable or not, but.
So that's my question. I mean, it's not that I'm against it. I'm wondering, it can be added to this.
Yeah, because
It's
this
a-
was we agendized the statutes that we're adding, or that is part of the proposal, so this is adding it as part of the proposal.
Okay.
Okay, so just to clarify, if you want to add a requirement for license renewal to take the law exam, you need to look at a different statute that is not currently agendized. If you wanted to authorize CE credit for completing the law exam every 10 years, you can add that as a new paragraph 6. You could also add as a new paragraph 7 the ability to get up to 2 hours of CE credit for attending board meetings. We can do that here, but the law exam requirement for renewal is a different situation.
So we could say that if you voluntarily took the law exam, it would count as 1 hour of CE credit. So I think that would be great. And then the 2 hours of CE for each cycle for attending a board meeting.
Okay, for the sake of time, we can move on, and I can draft some language and show it after lunch.
Okay, we'll discuss it then. Okay, and so where are we with the veterinary section 58.1? Are we finished? Okay.
Just to interject, the reason for the hour changes from the MDI was because we wanted to keep the proportions the same for the technicians and the veterinarians. So that's why that numbers were changed, I believe.
Yeah, and I apologize that I got ahead of us based on the screen, but Dr. Sullivan hasn't covered that yet, so he's going to go through that one.
Okay, so on the next page, and I have that on page 7, I think that's of your copy, 4858.2, and it reflects the same language as we have in 4858.1. Did I say that right? 4858.2 reflects the same language as 4858.1 for veterinarians. The sections in red reflect what changes that we made in 4858.1. At the bottom of page 7 in yellow is the new language that allows RVTs to receive up to 2 hours of CE for pro bono work related to spaying and neutering services in a specific setting. The subsection B, capital B, Roman numeral 1, we added the word direct for direct supervision and removed, and I quote, facility of or mobile unit that is, unquote, replacing it with veterinary premises. At the bottom of page 8, also in yellow, is a new section, B4, which allows up to, it was 16 hours. Now we made it proportionally the same as veterinarians. And it's 9 hours of continuing education credit, may be earned by participating as an expert in an examination preparation workshop for the national licensing examination. As noted, this replaces the regs that allowed for 16 hours to participate in a state examination development, which no longer exists. On the same page, subsection B5 has been reworded to copy the same language that we have in B5 in 4958.1 and changes the hours from 15 to 13 to give the same ratio as was for veterinarians. On pages 8 and 9 is the new BPC sections 4853.3, which looks very straightforward and replaces various regulations, except for the changing the old language in B2 from, and I quote, that an individual attendee can earn to, I quote, offered at the continuing education event, which you have in red. So we should probably stop and go over that.
I would just ask that on the number 4, the highlighted up to 9 hours, it's typed out 9 and everything else is in a numeric fashion. So
Any of those kind of edits will also be cut by Ledge Council. So whatever their format is, it'll reflect it.
For attending these meetings. Yeah, or you feel lost.
Any comments or questions from the board? Nothing? Okay, if there's no additional comments from the board, is there a motion for us to accept the MDC proposal?
So, I will make a motion to submit to the California State Legislature, I shouldn't make a motion.
Yes. So actually, I have some language. Justin, I'm gonna send it to you right now if you don't mind adding it to the proposal. I'll put it in our chat. And then a question would be also, would you want to allow up to 2 hours to also attend an MDC meeting?
Yeah. And I think for both, right?
So would it be 2 hours for the board meeting and 2 hours for the MDC meeting, or 2 hours for the board meeting or MDC meeting? Or, okay.
Also, I think we, in a proportional fashion, should put it in the RVT.
Yes.
Yeah.
All right, Justin, if you don't mind sharing that on the screen.
To be a little snarky, so does that person that comes for a disciplinary case, do they get the 2 hours?
I think so. They would be attending.
No, he's referring to a petitioner who comes before the board during a board meeting. Can they then earn continuing education credit because they're at the board meeting?
I'm going to take my NDC hat off. I think the CE credits are the ultimate purpose of CE, I think is watered down a lot already. I don't think a person who needs CE is going to come to a board meeting to pick up 2 hours or Zoom. I don't know. That's just my personal opinion.
There are several boards that do allow it, just to let you know.
I guess we would also have to, this would be outside of all of this, but, have a sign in, sign out type of a thing.
Well, you could restrict it to that portion that is up to 6 hours, where, you can read a journal or whatever. That's on your good faith. So if you're going to put it someplace, you might want to put it there.
Okay, so Justin just added it to your screen.
And then after, in new paragraph 7, second line, it says California Veterinary Medical Board, change that to just lowercase board. Change all of that because the board is referred to as lowercase board throughout the Practice Act. But then we'll add after board or veterinary medicine, multidisciplinary advisory committee. And that committee title will all be in title caps. So do we need to specify how someone will retain proof of compliance?
I do not think so. For 6 itself, we have the attendance records and the passing score to indicate that they did do that. And then for attending, we have the sign-in sheet here. We also track who actually attends virtually as well.
So we would need to insert, because you don't have to sign in. A member of the public attending a board meeting does not have to sign in. That's by law. If somebody wants to use this credit authority, we probably need to state in here proof of completion or proof of attendance. No, proof, I'm saying, how do we need to tell them they need to sign in. That's what I'm saying. So proof of attendance, shall be satisfied by signing the attendance register, something like that. That way they know they have to sign in to get this credit.
What if we did maybe earned by signing in and attending a board veterinary meeting?
And not in Zoom?
Well, because I don't know. I mean, I'm trying to establish so that staff, everybody knows that you can earn it by attending, and this is how you prove it. Proof of attendance shall be it's easier for me to type things and work it through than try to draft this on the fly as usual. How about the licensee shall, what? Well, read it.
Yes, ma'am. Just as an example for optometry, the language is a full day's live attendance at the California State Board of Optometry board meeting as verified by the board. Every 2 hours of open session equates to 1 hour of credit up to a maximum of 4 credit hours.
So you could add as verified by the board and it would be the board to verify. And if they don't sign in, we can't verify it. They can't get it.
I think you can also have something on the sign-in. I know in other meetings where I've gotten continuing education for the bar, they'll ask if you're looking for continuing education and you can sign in that way. So then it's sort of giving the public the acknowledgement that that's an option. But as Tara noted, it's not required that you sign in.
And they have to put their full name on the attendance on WebEx as well. So
Yeah, and we would put our license number as well.
So we could do after meeting, put in as verified by the board.
Right, and then with as verified by the board, if you start to experience problems with the sign in or log in, you could clarify in regulation.
Yeah.
If you needed
If we need
to.
it, yeah. So right after a meeting, Justin, if you could add as verified by the board.
That'll be a lowercase b.
Thank you. So, and I think that you're right now, you're in the RVT section. And so the request that that be pasted up into the veterinarian section as well.
Do you want to limit, put in a time limit on number 6 so that, because otherwise they could just take the log exam every 2 years?
Well, so it's only up to 1 hour and that's per renewal cycle. That's for all of these, they're per renewal period. I think
It doesn't matter.
I think to me, if they want to take the law exam every renewal period, I would be thrilled.
yeah.
It's the same exam, open book, right?
It is. It's a Survey Monkey right now. Okay. Now we can make a motion if you want it.
Okay, so can we, yeah.
No, it's changed.
we said we wanted to make the time different for RVTs and the veterinarians and the 2 hours earned. Is it the same?
It is changed. So right now he's
Okay.
back up at the veterinarian section. So Justin, if you don't mind now going to the RVT section.
Justin, you may want to copy 6 and 7 from here and we'll
Did.
paste it into the RVTs.
He was in the RVT section originally.
Great.
So he copied it and put it up at that section.
I'm sorry, Justin. You're so patient. I appreciate you.
There we go.
So it's 1 hour and 2 hours for both.
Yes.
Okay, and we're leaving it that way.
Do we want to leave it that way? I don't know. It's 20 hours of.
I know, I mean, it's 1 and 2. I'm fine with it. It's
Okay.
not that much, but is everybody okay being it? the
Okay.
same? Okay. Okay, so I am going to make a motion to submit to the California State Legislature the legislative proposal to repeal BPC sections 4838 and 4846.5 and add Article 3.1, sections 4858, 4858.1, 4858.2, and 4858.3 as amended today regarding continuing education.
I will second that.
Okay, so let's open the floor for public comment. We have somebody, Dr. Grant Miller, in the room.
Hi, I'm Grant Miller. I'm the Regulatory Director at the California Veterinary Medical Association. I have comments relating to Dr. Bradbury's proposal regarding the law exam and attendance at the board meeting. So regarding the law exam, my understanding is that they have to request the exam packet from the board and maybe pay a fee for that, and then they get the exam and take it and resubmit it. Is that how it works, or has that changed?
That's currently still how it works. The plan is to convert that into a course itself to where they have to watch the course, answer questions, and learn from it. That transition has not happened yet.
All right. And that would be self-study, that would be among the 6 units. Okay. So regarding the attendance at the board meeting, great idea. I think a lot of people will use that. I constantly get calls from doctors saying, oh my gosh, my license is due and I'm short like 4 units or sometimes more. And I need just quickly to find some CE. So that's a great additional opportunity. But I will tell you, doctors, veterinarians are pretty, they're type A folks, and they really get nervous if they don't have like a completion certificate or something that they can show for documentation. And I wonder if, and if you'd like to keep it as live interactive, you can, but I wonder if it's falling closer to the definition of self-guided and self-study for 2 reasons. One, logistically, it'll be much easier for the board because you don't, with self-guided and self-study, it's essentially on the honor system because somebody can say, well, I have a journal and I read it and there's 6 units. So it would be about the same in regard to attending the meetings. And if you think about it, the live interactive means that you have the chance to interact with the course instructor. And in these meetings, due to limitations, we really don't have that opportunity to interact the way we would freely like to. We're limited to 2 minutes of comment time. And it's not quite the same level of interaction that you'd expect if you attended a seminar, like, just a regular CE. So if you want to keep it live, great. There you go. If you want to keep it live, great. But I think it will reduce a logistical burden on the board by making it self-study. And it would relax the doctor who's looking for a completion certificate. And it would fall closer to the true definition because we're really just sitting out there listening and maybe making some brief comments here and there. Just some thoughts. Thank you.
All right, thank you. Now, okay, moderator, can you open it up online for comments?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And as a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. Our first comment is coming from Karen Atlas. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi there, my name is Karen Atlas. I am the president of the Animal Physical Therapy Coalition. I just wanted to chime in because I do know that the Physical Therapy Board does allow for CE credits for licensees of the Physical Therapy Board. So they might be a nice resource to connect with to find out more about how they deal with it. When I have attended board meetings, I've received CE units. I fill out a card at the actual meeting and then submit that. And then the board in turn verifies it and verifies the attendance therein. So that way the board can keep track of it and we can keep track of it as licensees of the board. So the Physical Therapy Board might be a great resource for you to connect with on that one. Thank you.
Thank you. Next, we're going to hear from Nancy Ehrlich. Hold on just a moment. We're going to send you a request to unmute your microphone. GK, if you'd like your comment heard, now is the time to raise your hand. Hold on just a moment, Nancy. GK, if you'd like to have your comment heard, now is the time to raise your hand. All right, please go ahead, Nancy.
Hi, this is Nancy Ehrlich. I'm the regulatory advocate for the California RVT Association. I just had a question on number 7, which says attending a veterinary medical board meeting. I would think you need to add in person or virtually because attending sounds like you have to be there in person. And if people are attending virtually, is there a way for you to know I mean, obviously their name comes up, but is that information stored? Is that some way that you can look it up later? That was it.
Thank you very much. And those are all of our requests for public comment at the moment.
Okay, we have an additional public comment in the room.
Sorry, technically I had 45 seconds left. Grant Miller, California Veterinary Medical Association. In regards to the additional language about attending the board meeting or the multidisciplinary advisory committee meeting, I would like the board to consider just striking multidisciplinary advisory committee and just writing a committee of the veterinary medical board, because we don't know what the future holds. There are other boards that have dozens of committees, and I'd like statute to kind of be something that we don't have to babysit over time. So if it's the VMB or any committee of the VMB, that would qualify, and that way we have flexibility in the future if we ever added any other committees to this board. Thank you.
Dr. Sussman,
Dr. Grant?
if we wanted to amend that to have the attendance at the board meeting to actually be Dr. Miller's suggestion as the self-study, wouldn't that solve a lot of problems if we just put it in there?
Yeah, so the board, instead of adding it to, and I'm talking about both sections, but it would be 6 and or 7. If you wanted to put that up to the self-study, we could copy it and paste it to 4858.1B2 and add a C and or a D if you wanted, if you want it part of the self-study. And then to address the other requests, instead of saying the Veterinary Medicine Multidisciplinary Advisory Committee, you could just say Board Committee.
I will make that, I mean, I accept that friendly amendment.
Can we get some clarification on what the text is going to look like? Because I'm a little confused.
Before we do that, can I just make a comment about it? So I don't see how that would be encouraging anybody, since right now they don't really have to do anything for the self-study and just say that they did it. Whereas this would be something where they're actually attending, they're filling out a card, which I love that idea. So I don't see how adding it would be encouraging anybody to come. And that's the whole point of my idea, was to encourage people to participate. But I don't, I also am not overly hung up on this. I just think that right now they can just say they've read a journal and there's no there's no proof that's required.
And then your thoughts on striking Veterinary Medicine Multidisciplinary Advisory Committee to Board Committee?
I like that because it also encourages people to, I think, participate in subcommittee meetings. And I don't know if we would want those to be or no, that I see Tara.
We typically use subcommittees to be more efficient.
Yeah.
They're typically only 2-person meetings. I mean,
I'm talking about like stakeholder meetings, which would then, in my mind, count as a committee meeting, but I don't know. In any case, I'm okay with that, changing it to committees, but I think it would be a little bit more vague.
Yeah, I mean, I guess I was looking at it from the committee part. I look at it as future, but I'm okay with leaving it as the MDC right now. I'm okay with that. But I don't look at the thing as just reading a journal, but I understand the part about this is not an interactive meeting. People come and they sit in the chairs and they listen. So I don't feel that this is an interactive session. And that's my concern. And then it puts more burden on them and us.
it isn't being, doesn't say it's an interactive, it's 2 hours. I mean, there's a lot of, there's hours of non-interactive that are allowable. So it doesn't say that it would count for the interactive portion of things, I don't believe.
And to the burden and the concern about the burden on the board, just, I was at optometry when we did it. It's not a burden.
Okay, so I'm fine with leaving it as is. Then I will remove my friendly amendment
Okay.
and leave it as is.
I think what, you know, I don't want to lose the focus on the intent right from the start, right? The intent was just like with the antimicrobial kind of quote unquote requirement. We want to create a focus on the need of being abreast with like any legislative changes or activities of the board. But I also see like we want to make it easier for veterinarians and RVTs to actually participate, right? So I guess at this point, I would say for me, trying to put a lot of restrictions and more like requiring, it would be more of offering them the opportunity would be enough.
Okay, so we have the motion and the second, and the language, it sounds like is staying the same for the motion. We did public comment, so I'm gonna. No, they decided not to. They wanted to keep it. Yeah.
Oh, the only other thing was, I think Nancy's suggestion about the adding attending in person or virtually, that might be clarifying. But
I mean, you could, it's not necessary because it doesn't specify one or the other, so we wouldn't be able to say, nope, that didn't count because we
Yeah.
wouldn't have the authority to do that.
okay,
And Jessica said that they keep, and just for clarification, Jessica said they keep attendance records virtually. So just so for that to be clear on the record that they do have attendance records for online.
So for clarification, we are keeping the multidisciplinary committee clause and not just saying in a
Yeah,
committee.
because Christy removed her amendment, so it's gonna, the motion that's currently on the floor is the same as what's
Okay.
displayed.
Kept it as the original amendment.
Okay, are we ready for a vote? Dr. Solicitor, ready for a vote? Yep.
Yes.
Okay. Ms. Pulaski,
Yes.
Dr. Bradbury,
yes.
Mr. Espinoza,
Yes.
Dr. Grant,
Yes.
Dr. Maniac,
Yes.
Solicito,
Yes.
motion carries.
Okay, so at this time, we would like to take a lunch break. We will be back at 1:30. Okay. Thank you very much. 1:30. And we are going to resume the agenda item 6. I guess we're starting with 6C. And Dr. Sullivan, take it away.
Yes.
Mhm.
Okay, now. 4841.5 is a section that you have approved on October 16th, 2024. The only changes in this section is under subsection 5, that's in yellow. And it is referencing the new Article 3.1 for CE. You want to do the other two and then discuss them all at once?
I think these are going to be relatively quick, and each one needs its individual motion. And so we could just go ahead and do them individually.
Okay.
But the motion is before you as well.
know if anybody has any.
So we're going on, right?
No,
Oh, okay,
Yeah.
gotcha.
Yes.
Yes.
6C. Let's make a motion. Okay.
I can make a motion, but I don't know if anybody has any questions. So,
That's-
okay, so I am going to make a motion. Oh my gosh, where did it go? I'm sorry. Okay. To submit to the California State Legislature, the legislative proposal to further amend BPC section 4841.5 regarding veterinary technician registration examination requirements.
Second, who's seconding the motion?
I'll second.
All right. Okay, so now we open the floor for public comment for agenda item 6C. Nothing in the room. Moderator, could you open it up online, please?
We are open for public comment on 6C. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. I saw a hand flash up and then it dropped. We're going to wait a few seconds to see if the hand returns or moving on. Seeing no request for public comment, do you wish to continue with the motion?
Yes, please.
Ms. Pulowski,
Yes.
Dr. Bradbury,
Yes.
Mr. Espinoza, Dr. Grant,
Yes.
Dr. Maniac,
Yes.
Mr. Solacito.
Yes.
Motion carries.
Okay, agenda item D, a proposed legislation to amend BPC sections 4846 and 4848.1 regarding veterinary license requirements. The changes are cleanup and clarifying language and are found on page 18 of BPC section 4846, subsection A5, capital A, Roman numeral 3. And on page 19, BPC section 4848.1, subsection D. In both cases, we are referencing the new Article 3.1 relating to CE because we have deleted section 4858.
Okay, I'll make a motion to submit to the California State Legislature the legislative proposal to amend BPC sections 4846 and 4848.1 regarding veterinarian license requirements.
I will second.
Okay, so now we open for the room for public comments for agenda item 6D. No comments in the room. Moderator, please open it for participants online.
We are open for 6D as in Delta. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the motion?
Yes, please.
Ms. Pulowski,
Yes.
Dr. Bradbury,
Yes.
Mr. Espinoza,
Yes.
Dr. Grant,
Yes.
Dr. Maniac,
Yes.
Dr. Solacito.
Yes.
Motion carries.
Okay.
Agenda item E, proposed legislation to amend BBC section 4883 regarding disciplinary action. This legislative proposal will amend BPC section 4883 subdivision K to authorize board discipline against a license, registration, or permit for the employment of fraud, misrepresentation, or deception in renewing the license. And that language can be found on page 4 of your packet and reads, Subsection K, the employment of fraud, misrepresentation, or deception in obtaining, and new language, or renewing the license or registration or permit. And I think the or permit was already approved.
Okay, I'll make a motion to submit to the California State Legislature that the legislative proposal to amend BPC Section 4883 regarding disciplinary action.
I'll second.
Okay, opening the floor for public comments in the room. I see no, anybody going to make a public comment. Moderator, could you please open it up online?
We are open up for public comment on 6E as in echo. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few more seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, thank you.
Ms. Pulowski?
Yes.
Dr. Bradbury?
Yes.
Mr. Espinoza?
Yes.
Dr. Grant?
Yes.
Dr. Maniak?
Yes.
Dr. Solcito?
Yes.
Motion carries.
Okay, action, agenda item 5, update discussion and potential recommendation for the telemedicine from the telemedicine subcommittee. The subcommittee decided to postpone this item in order to have a discussion with stakeholders before bringing it to the MDC. We hope to have that discussion soon and present it at the April meeting. So there's no action there. Agenda item G, update discussion and potential recommendation for the unlicensed practice subcommittee. Proposed legislation to amend BPC Section 4827 regarding veterinary medicine practice exemptions. The subcommittee was, among other things, tasked with pursuing legislation to narrow the scope of the licensure exemptions in the Business Professions Code, the BPC Section 4827, to prevent unintended consequences. Specifically, the board raised concerns with the owner exemption in that section, subdivision A1, and it being applied far beyond its intended purposes of allowing ranchers and farmers to provide veterinary services on their own food production animals. The board has also received many complaints about rescue groups abusing this section, causing harm to animals. However, since rescue groups are considered the owners of their animals, these complaints are closed. In addition, many unlicensed individuals in equine and small animal communities claim the services they provided were performed gratuitously and therefore exempted from the Veterinary Practice Act. And clients are hesitant to file a complaint because they have a long-standing relationship with these individuals and or appreciate the cheaper service. The subcommittee held 2 stakeholder meetings to explore this issue. Like the equine community, small animal stakeholders reported the prevalence of unlicensed practice in dentistry and reproductive services. In the middle of page 2 of that memorandum, since the intended purposes of the owner exemption was for food animals, the subcommittee recommended BPC Section 4827, subdivision A1, be narrowed as follows. Nothing in this chapter prohibits any person from 1, practicing veterinary medicine on a bona fide owner, as a bona fide owner of one's own animal is crossed out and instead livestock or food animals. This exemption applies to the following: 1, the owner's bona fide employees; B, any person assisting the owner, providing that the practice is performed gratuitously. When the committee tried to define livestock to include all animals that were raised, kept, or used for profit, it got bogged down with a number of what ifs. After a long discussion, including comments from the public, it was decided to refer the issue of defining livestock back to the subcommittee to see if there are other definitions that would fit our multiple needs. We had a brief discussion on sections 4827, subsection A6 and A7, but we also put a pause on this to see if the previous subsections move or not. If they don't move, then there's no need for these two added items. So at this point, I believe this is just informational. Okay.
I
Agenda.
think that.
Dr. Bradbury had a question too.
I'm sorry.
Go ahead, Dr. Grant.
I think it would behoove us to have some commentary from the public to get some more ideas and a consensus of how we're going to define livestock, food animals, pets, whatnot. I think it would help subcommittee, of which I'm a member, try to come up with additional wording. So I'd like to have it open to discussion by the board and also discussion from the public.
Yeah, I think it would be helpful if we talked about it a little bit, since I was able to listen to a lot of this yesterday. And I think one of the things that got bogged down more than anything was the how to classify horses. And then the fact that livestock and redefining that when there's these other definitions. I think Tara was concerned, that there's a lot of implications when we're starting to throw that terminology out there when it comes to like food animal medicine in particular. I liked Dr. Waterhouse's idea of changing this to just food animal, and that was I think a pretty clear definition of animals that it's really for producers and food animal situations where we want them to be covered under the exemption. And I think because there's so many horse rescues and that some of the major concerns that have come up have been around horse rescues that have been claiming that the unlicensed practice that was being performed on the animals were that they were owners and so on. And so that would be my thought. I liked the idea of taking out livestock and just sticking with food animals.
I think another thing that would be helpful from this board, because part of the board strategic plan, one of the objectives was to include equine into the definition of livestock. At the time that was recommended, for those of you that were there would recall, it was requested by a member, but there wasn't any discussion surrounding it. It was, there was no objection, so we added it to the strategic plan objective. And at the time, the concern was really related to the medical records requirement. And subsequently, the board, the MDC and the board addressed those concerns by structuring the requirements to apply to group or individual records. And so the initial concern of why we needed to include equine into livestock has now been addressed. So I guess the question would be, do you want the MDC to continue redefining livestock, knowing that the initial concern has been addressed? Or do we leave the current definition as is?
I don't feel that it's the definition of livestock that's a problem. I feel it's how it was applied, and I think that that's been addressed through medical records. I am I think I'm okay with food animal. However, that being said, I would not want to come up here and say, yep, we're good with it. I would like to, like you said, I would like it to go back and make sure that we've vetted it okay. But I think I mean, yesterday, hearing it, running through it, I think I think I'm okay with it. I just would like to run through that process again. But I do agree, when I heard that, it sounded legitimate. I think that would be a good solution.
So I actually would have, I think, an issue with trying to define livestock here, because there are other definitions. There's a federal Dr. Manos talked about the federal definition of livestock, and I just think that it really, if we're now defining it and there's like just all these different definitions, I see Jessica has something to add to that, but I think this got really convoluted with the any animal and individual training or animal that competes as an individual. And then there was the idea that there might be teams because of the, which there are horse teams. This was all related to horses. And to me, it was like including equines would be fine. Because there aren't food production equids. There's the federal government deals with the Mustang population. I think Marie did talk about how some of the horses are on large ranches are treated in a herd fashion, but yeah, I think that I like the food animal as a yes, Jessica.
Yeah, so one, to clarify, the definition of livestock is in current law, in our Practice Act. But the board had requested to add equine, and so it sounds like, from what you're saying, the proposal would be to the MDC would be leave the livestock definition alone, keep it as is, and then look at potentially changing the owner exemption to just food animals, correct? Okay.
And then I also just wanted to point out, because there was some discussion from the public, which I thought was really great to hear, because it does highlight the perception that is out there of what we're trying to do. And I think it's just important for the public to remember that that we are not an organization or a group that goes into, we aren't creating complaints. People have to file a complaint before anything happens. So it's not like if somebody is cleaning their cat's eyes or treating a wound or something like that, that they're in jeopardy of having discipline. Beyond that, there's in any case, we're responding to complaints. We're not looking for more complaints. Like, we're not trying to find cases. So I just wanted to clarify that.
I wanted to clarify, because like the comments yesterday, with regards to removing the exemption, current law, the states like the exemption only applies to livestock.
No, current law, if you look on the materials where it says animal that's been being stricken, that's current law, is that it says practicing veterinary medicine as a bona fide owner of one's own animal.
Okay.
So it applies to all, including livestock, food animal, your cat at home.
Yeah.
It applies, it's overly broad.
So because I'm getting confused of what the change we're trying to put in is, like the addition of equine in the exception, or the non-inclusion of equine in the exemption.
No, so there's kind of two different topics happening. The board itself had requested the MDC look at changing the legislation, the statute, to include equine. At the same time, they were asked the MDC to also look at narrowing the current exemption to go back to its intended purpose, which was for livestock and food animal production. And so that's why they're tied together, because if you put livestock in there, but the board also wanted to include equine, that's where it gets muddy. But if the board is saying, leave the livestock definition alone as is, now they're look, it sounds like the board is asking to not even include livestock in the exemption and only apply the exemption to food animal production.
Where does this leave the exemption being extended to
So
rescue groups of, right? Because I heard the concern yesterday.
So the subcommittee had proposed two additional sections specific to owners being to administer non-prescription drug or medications, and also for written treatment plan prepared by the veterinarian. Those are items 6 and 7. But rescue groups would not have the exemption any longer if you make it to food animals.
That's what I'm talking about. And I
Yes.
think that would be a huge negative impact to rescue groups, shelter organizations that are relying on this exemption to extend service to abandoned animals. The concern that I have is the fact that, as it has been said, we see the benefit of this, like the ability for these organizations to do, to be able to care for animals under their care because they're considered like owners. However, we also are aware of the abuse that some organizations, what you call this, use this, abuse this rule. So I guess it's a very slippery slope to say, to just remove it, because we have to also check like the benefits and the risks that we're taking with this legislation. So I'm a little on the fence because I see the need. I see how beneficial this exemption is for shelter organizations. I just don't want us to be looking at things so black and white that we're removing that ability for them to do that, so. Go ahead.
The subcommittee met with shelter representatives to get their feedback on the proposal. And those concerns were raised about the broad application on shelters. And in the conversation, we requested, what kinds of activities should be allowed in a shelter setting? Because what we're really trying to get at and prohibit is operations, surgeries on animals by owners, because the board is receiving complaints about rescue groups and rescue group affiliated individuals performing surgeries on animals. Is that okay? So this was our request. What activities should be allowed? And so that's why we wrote in 2 additional paragraph exemptions for, administering treatment, utilizing a veterinarian's written treatment plan, or treating with over-the-counter medication, because we've got to figure out a way to protect the animals. So, are there any other activities that should be allowed that won't compromise the health and safety of the animal? That's what we were hoping to hear. But, in follow-up written correspondence, the shelter representatives did not provide any additional information on that. They just said that they don't want the blanket exemption removed.
And I agree that having a well-defined scope of what those exemptions would allow is important, because as I said, I am also aware of how other organizations are, taking advantage of these exemptions. And yeah, the reports that we're getting about, I guess, technically unlicensed practice with surgeries and stuff for in certain organizations. However, I feel like that is a very small percentage compared to the general shelter community. So I think by just the consideration of eliminating what you call this definition for exemption for this organization and just say limiting it to livestock is going to be a very bad decision on the end of the board. But if we are going to continue on trying to define the scope of what this exemption covers for this community, the sheltering community, I think that might work best for the general good.
So I completely understand and agree it's going to have a huge impact on the shelter community. I just would like to hear from them as to what else is needed besides 6 or 7, though, because what besides administering a treatment plan that is given by, prepared by a veterinarian, which we've said is a written protocol, what do they need? And it just says other than anesthesia. So that's what I think we need, is that we need their input and we need feedback from them. What do they do on a regular basis that this is going to limit them so that we can help them and maybe get that into this language? That's the feedback that we were trying to elicit.
I just want to clarify too, although rescue groups is a big part of this, it's not limited to rescue groups that's abusing this exemption. We do see it a lot in equine, and Dr. Grant knows this as well. There's individuals who are who may or may not be licensed veterinarians in other countries that are coming in and performing surgeries on animals. And there's a lot of allegations of significant harm to those animals, but they're either claiming that they have ownership in the equine and therefore they can do it, or they're providing the services gratuitously, and it's hard to prove otherwise. And so the equine community has made a lot of allegations for that, where we have not been successful to move forward with any kind of action. Also, keep in mind with breeders and performing C-sections on their own animals on a kitchen table. They own the animals, they're able to do that currently, with the caveat that if the DA's office thinks they have enough to prove animal cruelty and that happens, then that's a possibility, but that's very rare to see that happen.
And you mentioned yesterday, Jessica, that you've had pictures, but people don't come forward, and it makes it very difficult when people don't come forward and support the allegations, because they've had relationships with these individuals. And so we want to help the shelters be able to support their population, but by supporting their population, we need to make sure that we're protecting the pets that are being harmed and not letting that continue, because that's a significant population as well.
I have a sort of just a separate question that comes up in this whole discussion, and that is with 4827A6, does this language allow for somebody to hire a pet sitter that may be licensed as an RVT to administer medication that a veterinarian has prescribed and that they were giving? Because I think we need to make sure that's allowable, because it's ridiculous that an assist, like just a random person can come and give insulin, but an RVT can't. So I just want to make sure this would allow for that
I
as well.
asked that question
Yeah.
yesterday.
So if the owner designates them as a caretaker, they have that ability to do that.
Just to follow up with district attorney prosecution for animal cruelty, one of the problems is that the law requires intent, intentional mistreatment of the animal, which, likely is difficult to prove when the owner is saying, well, I thought by doing this surgery or this, this treatment, I would be helping my animal. It's just that we're seeing a lot of lack of prosecution because they're also overwhelmed with other problems, with other cases that maybe are even more putting the general public at risk. So we're trying to find another way with respect to veterinary medicine itself, not just, misconduct with animals. We know what animal cruelty can look like, but what about harming animals through veterinary practice? So if there was a way to find some other actions that we could put in exemptions, that would be preferred, rather than to leave this existing exemption open wide for continued animal harm.
Why don't we give a time frame for them to come back to us with those exemptions that they would like, rather than them saying, we don't want any of them removed? And if they don't come back, then unfortunately they have to have those exemptions removed.
I think when we had the stakeholder meeting with them, Ms. Welsh actually dictated to them that we need to come back with something by the Monday, and they put a couple letters in here, but they weren't well addressed as to what additional things they wanted to have included. Whether we want to do that again and have more time for that again, I'm not sure, but we should give these other groups a chance to say what things they want to be able to do and a time limit on it so we can make a decision. But am I incorrect into thinking that the shelter groups, shelter medicine is a scenario where someone picks up a small dog, running off from a fire or something like that, and they take it into the shelter. So now the shelter's saying that they're the owner. But then the shelter finds someone else who takes the animal, and then subsequently they find out that the animal has a medical problem. So then they bring it back to the shelter, and the shelter wants to go ahead and diagnose and treat that condition, because do they feel like they're still the owner and these other people are just the foster parents for this dog? Or, I mean, there's got to be some point in time when the shelter, to me at least, when you go to a shelter and get the animal and you pay a fee, as I understand it, to make sure they're spayed and vaccinated and everything, and take it home, then it's your animal. And if it has a medical problem, to me, you're expected to take it to a veterinarian and have a veterinarian take a look at it. There shouldn't be, I mean, that's a responsibility of being a pet owner, is to understand that they have medical problems and you have to take care of them. To expect that the shelter is going to do something cut rate is not going to help get more veterinarians out there who want to take care of the animals at all. I don't think that's right, but maybe I'm wrong on that. Maybe that's just an example that's very far-fetched.
Actually, Dr. Grant, whenever an animal ends up at the shelter during the period where ownership is trying to be established, right? Because one of the first things that a lot of shelters do is to try to reconnect, animals that end up at the shelter with their owners. During the period that is being done, if there's any condition that is detrimental to the well-being of the animal, that is being addressed. Now, if it's not like urgent, like basic, like I guess first aid would be done as long as the animal is not left suffering. And so I guess at that point, the shelter does not have ownership, but more of like a stewardship during the period that those animals are, under their care. Now, within 14 days, if the animal is not claimed, then that is basically, for the lack of a better term, falls under the law of like abandonment. And so now the shelter has the ability to rehome those animals, but they'd never really take ownership of the animals. But it's just that under their care, they have to take care of the well-being of those animals.
They also do foster programs where it's, they're trying to find a home for a pet and they send them off and they're fostering and a person may foster them. They may be fostering them to try to find an owner. They may be fostering, but they're in homes and these pets are off in another home. They're not really owned, but their owner is the shelter, because the shelter can't keep every single pet in their shelter. They just don't have that ability. And so, but they also may be that this person came in and they want to foster the dog or the cat to see if it's a right fit. So there's different circumstances where I think, rescues aren't the only ones who foster. It's also shelters who foster. So I think we need to keep that in mind, that there are different things that make a shelter where they are still the owner and they may be in somebody's home.
Okay, I guess, okay, Tara.
Recently, the shelter community successfully lobbied the legislature to get various exemptions for shelter situations, and that is reflected in 4827 subdivision A, paragraph 5, which provides the following care to animals lawfully deposited with or impounded by a shelter, not registered with the board pursuant to 4853. There's, 3 different ways that shelter staff can treat animals, especially when they're on intake, but that's not limited to intake. So this is administering prescriptions and medications, vaccinations, all of that. So, if the shelter community needs, additional exemptions, they already have a good beginning on what those exemptions look like. But again, do they think that they need the ability to perform surgeries on these animals as owned animals? So what is it? What activities do they need to do to a large population that we can put in the exemption?
So from my understanding from the meeting on Monday, and I'm sure they can provide public comment, and correct me if I'm wrong, wasn't necessarily what additional things shelters want to be able to perform on animals. It's the fact that they want owners to be able to provide any kind of care that they feel is necessary to their own animals. And the thought is, if they can no longer provide treatment to their animals, then they have to get a veterinarian to do said treatment, then instead of doing that, they're going to relinquish that animal to the already overfilled shelters who can't stay on top of it, which then would result in potentially more animals being euthanized. So it wasn't so much of the shelter saying, no, we want to be able to do more. It's they're concerned about the consumers not being able to care for their own animals. And so in that discussion, that's where we had asked what else other than the 2 sections that are listed is appropriate for owners to be able to do to their own animals without a veterinarian on board.
I think we should just open this for public comment so that maybe we could get more insights, So any public comment from the room? Yes, we do have one.
Hi, Grant Miller from the California Veterinary Medical Association. So one of my public comments is reserving my right to make further public comment should we continue on and we get to the items 6 and 7. I kind of got gummed up in that whole mess yesterday and couldn't actually make comments on those, but I have some just substantive comments, nothing about the intent, but more about like how I think the wording could be. In circling back to this conversation, the CVMA doesn't have an official position on this particular legislative amendment, but we do support the board's concept of curbing illegal practice, which I think is, I mean, the shelters is not, that's one part of this, but the illegal practice is something different. And that's where I think we're seeing a lot of trouble. And we like the concept of trying to do anything we can in legislation to curb illegal practice. I will tell you, this is not the first time the CVMA has been at the table on this, trying to get our arms around this in some way. And every time we've tried in history, it's resulted in similar types of kind of conversations that we're having now amongst this board. I won't speak for the shelters, but I can tell you that on the shelter side, not all shelters are the same. So when Dr. Salicita was talking about the 14-day hold period and the ability for the shelter to do things in that period, that's 597.1, that applies to municipal shelters. But there are also private shelters, and the private shelters contend that they only have a 72-hour hold period based on a separate section of the law. And then there are rescues, which are kind of even a totally different ball of wax. So a shelter is not a shelter is not a shelter. And I think that that community is greatly concerned about not only their abilities, but really the abilities of the people that they serve. Because generally we know that, you know, roughly a quarter of the pet owning population really can't afford to come to a vet. And so they do end up crossing paths in one way or another with a shelter. And so I think the shelters are compelled to speak out for those folks who might be doing a lot of their own veterinary medical practice on some of the animals. And while the items 6 and 7, which have yet to be discussed, partially get at that, they don't fully get at it. On the equine side, I can tell you, like, one of the most common things we see is hoof abscesses, which probably next to colic, hoof abscesses are like the most common thing that we see in horses. And it's really common for people to either call their farrier or call their vet. The farrier is the horseshoer. And whoever gets there first or can get there first can carve out the hoof abscess. And so with this, I think they worry about, well, you know, no longer should the farrier be doing it, it should be the vet. And so that's an example of something where, you know, people get nervous when we start to talk about these things. But
15 seconds.
In general, I think that the idea of curbing illegal practice is a really good one. If the wording can be done in such a way that doesn't cause unintended consequences for those who are doing good things and things that we want to continue to allow them to do every day.
Time.
Thank you.
All right, we have another public comment.
Oh, there's a button there.
Okay, thank you. GV Ayers with the Animal Physical Therapy Coalition. We participated in the stakeholder meeting on unlicensed activity there as well. Made some suggestions, made some recommendations in that, and none of the recommendations were even commented on in the MDC's report or in their discussion, and so we're a bit frustrated at some of this. We think that obviously, what you're talking about with unlicensed activity involves consumer harm, or involves animal harm to the animal. But there are a number of issues where there is not harm to an animal. And we think that there could be allowances made in the law to where a veterinarian could refer to an allied profession, such as what we may have talked about in agenda item number 8. And where there's no demonstrated public harm done, and that takes care of those complaints that are complaints of unlicensed activity only, but there's no consumer harm in them. That would address some of those there. it's a complex thing to be ferreted out and to be, no pun intended there, but to be sussed out and worked on there. But we would appreciate consideration of that on an ongoing basis as we go forward. Thank you.
Thank you. I guess we don't have any more public comments in the room, so moderator, could you please open up for public comments online?
Absolutely. We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. First, we're going to hear from Juliana Tetlow. Hold on just a moment. We're sending you a request to unmute your microphone.
Afternoon, CVMB members. Thank you for the opportunity to speak today. I am Juliana Tetlow, and I represent San Diego Humane Society, which is the nonprofit animal care and control agency for most of the San Diego region. I am here to urge you to reconsider eliminating the ownership exemption in the Veterinary Practice Act. I want to clarify too that the concerns from the sheltering community, and I don't speak for everybody, of course, but from this shelter, are what Ms. Sieferman mentioned. When owners cannot provide basic care to their owned animals, and that is what the removal of the exemption will say in statute, regardless of whether that's the intent or not, and they can't access veterinary care, we end up with them. The ownership exemption is critical for ensuring timely and affordable care for animals in situations where licensed veterinary services are unavailable or inaccessible. The exemption allows animal owners and caretakers to provide basic necessary care without facing legal barriers. Eliminating this exemption could disproportionately harm individuals in rural and underserved areas where access to licensed veterinarians is already limited. Furthermore, it is important to note that the ownership exemption does not shield individuals who commit acts of cruelty under the guise of veterinary care. Existing law allows for criminal prosecution in cases where individuals harm animals through neglect, cruelty, or unqualified procedures. Eliminating the exemption would penalize well-intentioned caretakers while doing little to address the actual cases of abuse, which are already enforceable under current animal cruelty statutes. What the discussions I've heard thus far seem to fail to acknowledge is that the practice of veterinary medicine is not limited to surgery or operating on animals. Thank you. The practice of veterinary medicine includes treating and preventing health issues. The statements from members of the MDC yesterday that this exemption elimination is not intended to criminalize care provided to pets by their owners was nice to hear, but by simply removing that exemption, it literally does that. Instead of removing the exemption, I urge you to consider identifying deficiencies in the enforcement process, additional oversight, or providing additional education to support to ensure care remains ethical and safe. Striking a balance between professional regulation and practical necessity is the key to safeguarding animal welfare without creating unnecessary burdens. Thank you for your time and for considering the needs of animal caretakers and the vulnerable animals they serve.
Thank you. Next, we're going to hear from Karen Atlas. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi there. Thank you for the opportunity for me to speak today. My name is Karen Atlas, and I'm the president of the Animal Physical Therapy Coalition. Our coalition represents veterinarians, physical therapists, RVTs, and the animal owning public. So on their behalf, I provided in-meeting public comment and attempted to engage in discussion and sent in 2 letters on behalf of the APTC to be considered for each of the small animal and large animal stakeholder meetings on unlicensed activity. Unfortunately, I'd like to state for the record that despite all of these considerations and exemption alternatives that we provided, not one of them was considered or even spoken about. So because the MDC proposal
to the VNB relating to unlicensed activity does not include any of the alternative solutions that we offered up by this committee. Makes us wonder if these public stakeholder meetings are really even meaning anything to this board. It's just been extremely disappointing to spend hours preparing alternative solutions for this board, only for them to be ignored time and time again. I urge you to listen to stakeholder input and to consider them when you are making new legislation and regulation that will affect the public. I also want to note that we do continue to hear this board talk about that these rules are being made because of harm, but we have yet not to prove a single case of harm that I know of when making some of these rules. So it would be nice that there would be some concrete evidence to show harm before making rules that would create more barriers to care. Thank you.
Thank you. Next, we're going to hear from Carrie. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi, my name is Carrie Calais, and I'm a member of the public. First, I'd like to know how long my time is to speak, please.
3 minutes.
Thank you. As I said, I'm a member of the public, and I've been following this issue as closely as possible. First of all, I'd like to really applaud and second the statements of Karen Atlas and the other speaker from the Animal Physical Therapy Coalition, and also the person on the board, the woman on the board who spoke to the ambiguities and problems associated with rescue and shelter groups. I'd add also to that it seems like rehabbers would be subject to this. And also, you brought up farriers. This is a huge thing. I'm sure that this would be a huge problem if it were publicized adequately, not just kept within the Veterinary Medical Board email list and the small number of stakeholders who have responded. I feel that it's obvious, really obvious, that this whole effort, this whole proposal for legislation or regulation is extremely premature. There is just no way it should be voted on today. It needs a lot more work. I think the public needs to know about what's going on a lot more than you've done in terms of publicity. I think also that's what struck me is that there's so many generalizations that are put out there in terms of describing the number of complaints. No one ever says the number of complaints. Where is that published?
1 minute.
It's the word a lot and the word many don't mean anything. Obviously, there's cruelty and intent. Those are terrible, but we also need to know exactly which procedures you're objecting to. Is it just surgery? Don't shelters employ surgeons to do those within a shelter situation? I mean, there's just so many holes in this. It's like Swiss cheese. I urge you, do not put this forward right now. You have a lot more work to do when it comes to specifying this for the legislature to take a look at. It's really, 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 really premature. Thank you.
15 seconds.
No, that's all I have to say. Thank you.
Thank you. Next, we're going to hear from Bruce Wegman. Hold on just a moment. We're sending you a request to unmute your microphone. All right, Bruce, I see you've unmuted. Are you with us?
Hello.
Hello.
Can you hear me?
Yes, go ahead, please.
Okay, great. Thank you very much.
Thank you for allowing me to present today. My name is Bruce Wagman. I am a lawyer with an exclusive practice in animal law. I represent 55 shelters in California, 35 different rescues, and dozens of individuals, and run a legal policy program around animal and shelter law. And all of my clients will vociferously oppose this because the proposal to remove the ownership exemption will have devastating effects on access to care for California pets and their owners, on the public at large, and on shelter populations. Crucially, the ownership exemption is used on a daily basis by owners around the state to allow intervention to prevent, relieve, diagnose, and treat illness and injury in California pets. Note that 36 different states have the identical exemption, and nobody's moving to change it. I think the drafters of this language certainly may not have intended to come directly into our homes, but they actually are. And they will prohibit California pet owners from taking care of their animals. The drafter's intent is really meaningless in light of the indisputable language if you look at it. Let's compare Business and Professions Code 4826, which defines the practice of veterinary medicine and includes administering a treatment of whatever nature for the relief of a wound. So if a dog comes into my house and has a superficial bleeding wound, and then I put on a bandage or I wash it with soap and water, I have just done what 4826 says is the practice of veterinary medicine. If you take away that opportunity, either I'm not going to do it and my dog will suffer, or I'm going to do it and I will feel like I'm doing something illegal. If I'm a law-abiding citizen, I'm going to be chilled by the removal of the ownership exemption. Another quick example, if I put my cat with chronic upper respiratory disease in a room with a humidifier, I am clearly administering a treatment for the relief of a disease. Again, violating 4826 if I don't have the ownership exemption. There are a dozen more examples. So every good California pet owner who wants to do good things for their animals, now they're lawbreakers, and the change will have a horrible chilling effect. We agree that there are unfortunate examples of harmful things happening to animals by people engaging in practices that would amount to animal cruelty. I want to point out I do an awful lot of work around California Penal Code 597, and 597B does not require the malicious intent that's been stated. So that it is clearly still animal cruelty. We agree that those are problems, but what the Veterinary Medical Board is doing here is suggesting is throwing the baby out with the bathwater. Good people will no longer be able to do their work. Dropping an atomic bomb on a street gang to end a street fight. The owner exemption allows thousands of Californians to provide important care to their animals and must be maintained. Thank you.
Thank you. And that appears to be our last request for public comment.
Thank you. Any further discussion from the board? Dr. Bradbury? No.
I was just going to say, I think it looks like you have your work cut out for you, Dr. Grant. I'm wanted to thank everyone for coming and talking about that.
I guess.
Okay, agenda item H, proposed legislation to amend BPC section 4875.2 and add section 4875.7 regarding unlicensed practice citations. Subcommittee also was tasked with seeking statutory changes to enhance unlicensed practice penalties to decrease unlicensed veterinary practice. The board is concerned the $5,000 cap in BPC section 125.9 is too low to disincentivize unlicensed activity. Through the board's executive officer, the subcommittee surveyed all other member boards of the American Association of Veterinary State Boards to see if any other boards have a cap on administrative fines for unlicensed practice. Of the 14 boards that responded, none had such a cap. During the stakeholders meeting, the subcommittee proposed increasing the unlicensed practice citation amounts, and attendees appeared to be in favor of the increase. As such, the subcommittee recommends the attached legislative proposal to increase the range associated with unlicensed practice and remove the overall cap on unlicensed practice citations. So amend section 4875.2 of the Business Profession Code as follows. I believe this is on page 28 of your packet. This section is simply adding VACSP and veterinary premise registration holders to the list to the list of those that may receive a citation. 4875.2, if upon completion of an investigation, the executive officer has probable cause to believe that a veterinarian, a registered veterinary technician, and here's where we add veterinary assistant controlled substance permit holder, or addition veterinary premises registration holder, and deleting an unlicensed person has violated provisions of this chapter. And again, in the next sentence, it is adding those two components and removing unlicensed person in that stead. In addition, we are looking at section 4875.7 of the Business and Profession Code. This section is new and removes the cap on citations. If I'm reading this correctly, I believe this is new, correct? So this is the portion. This is the statute that removes the cap. Let me go ahead and add in yours. Well, let's do that. Let's just do them one at a time.
Well, I would like to make a motion to submit to the California State Legislature the attached legislative proposal to amend BPC section 4875.2 and add section 4875.7 regarding unlicensed practice citations.
I second.
Okay, so we're going to open this for public comment in the room. Anyone? Okay, I guess there's no public comment in the room. So moderator, could you please open it up online?
We have opened up WebEx for public comment on the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. And our first request comes from Karen Atlas. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you so much for this opportunity to speak. My name is Karen Atlas. I'm the president of the Animal Physical Therapy Coalition. My comment is much like the one I just gave, that our coalition attended all of the stakeholder meetings on unlicensed activity, and not one of our recommendations was incorporated or even discussed. We had other ways to help deal with this issue other than just increasing fines, and none of our recommendations in that vein were entertained whatsoever. And I know I said it yesterday and I'll say it again because it keeps getting said that attendees appear to be in favor of the citation increases. Well, there were attendees that were not in favor of the price increases. So I just wanted to state that for the record, that it is inaccurate to say that. Thank you. Bye-bye.
Thank you. Next, we're going to hear from JC. Hold on just a moment, JC. We're sending you a request to unmute your microphone.
Thank you for the opportunity to speak. As a member of the public, I am also against these fine increases. It seems like many doctors who are practicing are being hit with fines that are unnecessarily high to shut down their practices, and increasing these fines without proper investigations, I believe, are unnecessary. And again, we are opposed to this, so thank you.
Thank you. Next, we're going to hear from Carrie. Hold on just a moment. We're sending you a request to unmute your microphone.
Hello again. Yes, my name is Carrie Calais, and I am a member of the public. I also want to say that one of the members of the board mentioned earlier that they're only responding to the number of incidents with a complaint, and that there was no intent to go out seeking any incidences. However, I remember from the second stakeholders meeting that there actually was serious discussion of trying to find money to do undercover stings. So I want to bring that into the public record, that was at least an intent of the board, or the committee rather. Sorry, I apologize. But this is really, because this proposal is so premature, I hope that the board does not vote to go ahead with this. And I also think that that these fines really need to just be put by the board, put on the table, as well as the rest of the proposal. Thank you.
Thank you. And that appears to be all of our requests for public comment at the moment.
We do have a public comment in the room.
Hi, Grant Miller, California Veterinary Medical Association. The association has no formal position on the board's statutory proposal to change fines for unlicensed practice, but well, I'm not going to ask a question. I'm just going to clarify to the other commenters, these fines are specifically for illegal veterinary practice. They don't affect veterinarians. It has to do with illegal veterinary practice. And also, the comments that are being made are tangential to the conversation about the fines. So while we don't have a formal position, our leadership is at least aware that the board has done a significant amount of work in researching this, and we don't believe it's premature to be addressing this now. We believe that this has been very well thought out. And while there still is time to make a formal position, we do believe that this should move forward at this time. Thank you.
Okay, no more public comments. Yeah, Dr. Bradbury?
Yeah, I was just wondering if Jessica could just explain and clarify what this actually would do, and in the stakeholders meeting when talking about the undercover operations, which are only initiated from a complaint, but just can you clarify a little bit so that any public misconception can be cleared up, please?
I can try. So just to clarify, we can investigate from the basis of a complaint, but we can also do internal complaints. So we can open up our own internal investigation. We don't have to have complaints. But in general, the purpose of a citation is never used to increase revenue. That is not the purpose of a citation. So that's never part of the discussion is, oh, we need revenue, we're going to do more citations. That's not the purpose of a citation. Is to incentivize compliance with the law. And so there was a discussion during the stakeholder meeting regarding the challenges that we're having for investigations specific to the Division of Investigations and the need for us to get our own special investigator. There was a recommendation or a comment regarding potentially supporting increasing our licensing fees to help support another or one or more special investigators to help with this issue. But I had clarified at the time that, and members know, that we had already reclassified a current position into a special investigator position. And we were able to do that without the need to increase fees. And so we are addressing the special investigator concern. We also are looking at, we have a new vacancy in analyst position that we also will reclassify without the need to increase fees. So we will have our own special investigators. But again, the citation amounts are not in any way tied to the need to increase revenue.
Thank you. And I just, again, for the investigations, these are usually generated from a complaint. Sometimes there's an internal investigation that's been initiated, but usually from some sort of information that's been passed along to you. It isn't just a random, we think we want to investigate people. It may be for unlicensed activity, and the only way to know if it is actually happening is to do an investigation, and that requires an investigator. And so they are being investigated. It isn't just sending out a citation, and that's why we would need an investigator. I think there's a lot of misconceptions by the public, and since there are people who are interested in this and enough to come and talk about it, I wanted to make sure that we clarified that. Thanks so much.
Okay, so what do we do now?
All right, are we ready for a vote?
Yes.
Okay, Ms. Pulaski.
Yes.
Dr. Bradbury.
Yes.
Mr. Espinoza. Dr. Grant.
Yes.
Dr. Maniac.
Yes.
Dr. Solocito.
Yes.
Motion carries.
Okay, agenda item I. Proposed rulemaking to amend California Code of Regulation Title 16, Section 2043 regarding unlicensed practice citations. CCR Title 16, Section 2043 requires citations issued by the executive officer to include a classification for the violation for which the citation is being issued. The regulation establishes the unlicensed practice violation are Class C violations with a civil penalty in amount no less than $2,000 and not to exceed $5,000 for each citation. If the legislative proposal so stated is successful, there is no longer a need for unlicensed practice citations to be assigned a classification. As such, the subcommittee recommends amending CCR Title 16, Section 2043 to remove references to unlicensed practice citation. That is on, I believe, your page 30 of your packet, and it's removing subsection E.
Okay, any comments from the board?
I'll make a motion if we're ready.
Go ahead.
Okay. Make a motion to approve the regulatory text to CCR Title 16, Section 2043. Direct staff to submit the text to the Director of the Department of Consumer Affairs and the Business, Consumer Services and Housing Agency for review. And if the board does not receive any comments, providing objections or adverse recommendations specifically directed at the proposed action or to the procedures followed by the board in proposing or adopting this action, then the procedures the board authorizes the executive officer to take all steps necessary to initiate the rulemaking process, make any technical or non-substantive changes to the package, and set the matter for hearing if requested. If after the 45-day public comment period, no adverse comments are received and no public hearing is requested, authorize the executive officer to take all steps necessary to complete the rulemaking and adopt the proposed regulations as described in the text notice for CCR Title 16, Section 2043.
I second the motion.
Okay, now we open the floor for public comment. Anybody in the room? I don't see anybody going to make a comment. So moderator, could you please open it up online?
All right, we are open for public comment on the new motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We've had several hands go up and down, so please make sure your hand is up if you wish to speak. Our first request comes from Karen Atlas. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi there. Thank you for letting me speak today. My name is Karen Atlas, and I'm the president of the Animal Physical Therapy Coalition. We are a coalition that represents veterinarians, physical therapists, RVTs, and the animal owning public. I just wanted to state for the record for this action item that is being considered that we submitted substantive alternatives to this for this unlicensed activity issue, and none of them were considered as a remedy. And so I would like to state that for the record that the public comments were not incorporated whatsoever. Thank you.
Thank you. And we're going to wait just a couple more seconds to see if any new hands pop up before we proceed. Seeing no additional requests, do you wish to continue with the motion?
Yes, please.
Ms. Pulaski?
Yes.
Mr. Bradbury?
Yes.
Mr. Espinoza?
Yes.
Dr. Grant?
Yes.
Mr. Maniak?
Yes.
Mr. Solacito?
Yes.
Motion carries.
Okay, agenda item J.
Before you continue, we received a request to take a 5-minute break.
Oh, yes, I forgot. Yeah, can we please take a 5-minute bio break? I turn it over to Dr. Sullivan.
Okay, agenda item J, again, a very, very important one. Update discussion and potential recommendations from the registered veterinary technicians subcommittee, a proposed rulemaking to repeal CCR Title 16, Section 2068.6 regarding out-of-state registrations as equivalent. Background: during previous board meetings, board members have raised concerns that not all pathways for RVT applicants to obtain a registration are equivalent. Currently, RVT applicants who are not registered in another state are required to complete some amount of education to qualify for registration. DPC Section 4841.5, as explained in detail on page 1 of agenda item 7. The board, through the California Code of Regulation, Section 2068.5, deemed a combination of education, 20 semester units or 30 quarter units or 300 hours of instruction, and 4,416 direct clinical practice experience in specified areas to be equivalent to the 2-year curriculum. In addition, CCR Title 16, Section 2068.61, the board deemed an out-of-state registration equivalent if the applicant meets the following requirements. 1, the applicant is licensed, certified, or registered as a veterinary technician in the United States, Canada, or U.S. territory in good standing as defined in Section 4848 B1, capital A and capital B of the Business and Professions Code, in which the board has determined that he or she has passed the National Veterinary Technician exam or an examination equivalent to the written examination last required in California. 2, the applicant has obtained at least 4,416 hours completed in no less than 24 months of directed clinical practice under the direct supervision of a veterinarian licensed in the United States, Canada, or U.S. territory. 3, the directed clinical practice shall have provided the applicant with knowledge, skills, and abilities in the areas of communication with clients, patient examinations, emergency procedures, laboratory procedures, diagnostic imaging, surgical assisting, anesthesia, animal nursing, nutrition, dentistry, animal behavior, and pharmacology. The supervising veterinarian or veterinarians shall complete a checklist attesting to proficiency in specific skill areas within the preceding categories. And 5, the board determines that no disciplinary action has been taken against the applicant by any public agency concerned with the practice of animal health care, and that the applicant has not been the subject of adverse civil or criminal judgments resulting from the practice of animal health care, which the board determines constitutes evidence of a pattern of incompetency or negligence. And I have in bold Notably, there is no education component required. Presently, there are 4 states that will allow a California person to qualify to sit for the NVT&E with hours of work experience and no educational requirement without ever leaving the state of California. Some board members were concerned this may be inconsistent and or unfair requirements to those applicants applying through the education and experience pathway defined in section 2068.5. As such, the MDC was tasked with reviewing the RVT pathways further and making recommendations to the full board. The subcommittee held 2 stakeholders meetings to review the current pathways and receive feedback on how to make the RVT requirements consistent. The 2 meetings were necessary to hear both sides of the story. Based on the feedback from both meetings, the education is important to patient and client safety. The subcommittee recommends requiring some component of education for all RVT applicants. As such, the subcommittee believes CCR Title 16, Section 2068.6 should be repealed.
Okay, any comments from the board members? Dr. Bradbury? Yeah.
Okay, so first of all, I think the person that was most concerned with this, and my concern was that it was limiting California applicants, and my intent, at least my perception of this, is that we have a number of RVTs in our state right now that have been practicing, I believe, since 1989, at least, that have become an RVT without education, and there's no evidence that they have posed a threat to consumers in California, and they have been. We have very few RVTs. We're looking for more RVTs, and they've been, I think, a valuable asset to our community. Further, we have a number of RVTs still practicing, I believe, that have been grandfathered in without education, and we feel like they are competent enough to be practicing as RVTs and are not posing consumer threats. We're not looking to take away RVT licenses. So to me, it seemed like this was we should be fair, and it kind of went in a different direction, obviously. And then when I read this memo, and then when I listened in yesterday, it really highlights how we all have different perceptions of what we are hearing and seeing, because my experience in that second stakeholder meeting, I went to both stakeholder meetings. My experience in the second stakeholder meeting was very different than what Christy's experience was. I did not hear from those stakeholders that education should be required. I heard from one of them that they felt like it was a good idea. I had there was another, I think, that was on the fence, saying they could see why it would be important, and they got their own education afterwards. But there were others that said that this would have been the only way that they could get their RVT license. These are people that are working full-time jobs, sometimes 2. They didn't have the ability to go to school or the finances to go to school. And they were very grateful for the opportunity to become an RVT and really strived to do better as RVTs. So I felt like it was a very different than the representation that I heard during the MDC meeting. And I was sad because I felt like the people who this really helped weren't being, their voices weren't being expressed during the MDC meeting yesterday. So I just want to say that to those people that at least that's what I heard, and I don't know if others who attended the meeting, if I heard this wrong. I don't know, because obviously we had different perceptions. I feel like removing this pathway is removing an opportunity for people who are from underrepresented communities and that are struggling. The RVT educational programs in general are expensive. And it may, $20,000 or $40,000 to one of us may not sound like a lot, but my RVT that I have, that I employ is living month to month, I pay her very well, and she is still trying to pay off her loan. The first stakeholder meeting was all people from education, and I feel like, of course, they see the value in that, and I am a strong proponent for education, but I am not in favor of removing this pathway. I think that it's taking away something, a pathway to employment, and to a license that people have worked very hard towards. They are taking a very difficult test. This isn't asking for people to become licensees that have not passed a very rigorous test that at least half of the test takers fail. And I don't know how we're going to be able to defend this at sunset, taking this away. So I am not in favor of this, and I will be voting no.
Yeah, I don't think I said that. I think what I said was that they all were, it wasn't about them they all knew that education was important. So I want to be clear on that. They all felt education was important. And that is why we came back with, they were all very concerned with the alternate pathway going away. That was their concern on the second stakeholder meeting. And so the people that were on the second stakeholder meeting went back for education even after they got their RVT. So all of them, it wasn't just one person. It was all of them said education. We asked them point blank, do you feel education is important? And they all said yes. That was I have it all in my notes and written down. Every single one of them said education was important, which is why even after they got their RVT, they went back and got education because they felt it was important, and they were saying the same things, the why. And so I was with you when we were the two members of the board that brought this up, because I felt the same way you did. And so I went in this with a very different perspective and thinking, okay, this is like, we need to defend a different position, and I told myself I'm going to stay really very neutral on this, because it's about consumer protection and there is no harm being done. But if an RVT says that they need education in order to be able to educate a client and to be able to know the why behind why they are administering a therapy, that is absolutely consumer protection. I don't think that's hard to defend. And that is why I was able to come into the position that I did, which completely changed from, I did a 180 on this, because it is absolutely consumer protection when an RVT says, I went back to school to get an education after I took a VT&E, passed it, got my RVT, was practicing, but I didn't know the why behind what I was doing. To be able to explain to this client this medication, or to explain to this client the therapy that the doctor was asking me to do, I needed to understand it. That's consumer protection.
So are the consumers not being protected now by the number of people that are out there? Is that what we're saying? That are practicing, we've allowed to be RVTs?
it's not retroactive. I'm not going, we determined that yesterday, and that was a question that was asked. It's not retroactive, but it falls on the veterinarian to be able to determine whether they're competent. And so that's where the complaint's going to lie, is like, did the veterinarian turn them in? And it's still going to move forward. But do we say that laws that we have made in the past are the best? Or do we say that moving forward, we're going to do what's best? Because sometimes things change. And so sometimes we have to do what's best right now. We don't, things that we made in the laws that we made in the past are not always best.
Okay, Dr. Grant.
Yeah, just for reference, at least from a personal standpoint, I never feel like I have enough going on that I don't want to get continuing education or consult with somebody or go to another course or do something. I think that's part of being a professional and growing all the time. And to eliminate people who want to continue doing that, not even give them a chance to step through the door, which this possibly might do. I think this is a way for them to get the door opened. And I would hope, being a professional, if they were unaware and they didn't feel like they knew the right thing or how to make a recommendation, that they would consult with either their employer or someone else to get the right information.
Yeah, and just to that point, all of the people that did this did go and further their education, but now they probably were in a better position where they could make a little bit more money. They had more time. This did allow them, it opened the door for them to know what they didn't know and go and get the education. And they all said that they were doing that, which it argues that they are going to continue to better themselves, whether they had a pre-education or not.
My take on the stakeholder meeting, the first and the second round of it, was everybody agrees that education is of value, but it's more of, I think, a nice to have rather than a must have, because of, again, the economic impact that it has on, like, the RVTs that would like to be able to that vet assistants right now that has been in the industry for years and have been wanting to get their licenses. However, they're being restricted because of the requirement for education. And as Dr. Bradbury had mentioned, if we could help them get into the workforce at a level where they would be paid more, so that they will be able to pursue continuing education, maybe that is something that the board can consider. I understand that, there were a lot that were mentioning that, some of the licensees from out of state, we have issues when they come in, they really don't know much, we have to retrain them or whatever. But it's the same thing when you hire somebody who just got out of tech school and got their license. You still have to train them. You still have to reinforce the education that they have. So I think, there is of significance for the board to consider that, will this actually repealing CCR Title 16, 28, 68 is going to help us as like the industry itself? Is it going to create harm, or would it actually facilitate providing more care to our constituents, to the pet owners, or to the the owners of the consumers of California? So I think we all need to look at it with at a balance. So now we open this for public comment. There's another comment. Okay. Do you have any questions or comment?
Hello. So just so I understanding correctly, a California RVT applicant would have a greater barrier to entry in the industry with respect to the educational requirements on them vis-a-vis someone coming from out of state. Is that correct?
There's 4 states that don't have an education requirement. There's only 4 states. All the other states have education requirements. So it's only these 4 states. So basically, they can go to these, a person is not, what we're saying is that a person does not have to leave California. They're not leaving California. They're living here. They don't have to show residency. They can go to Wisconsin, take the VT&E, just literally take the VT&E in Wisconsin and come back here in California, and they have not, residency has not changed. It's literally for the state, the purpose of taking the VT&E and show through the steps that we've shown in here in the packet of I've taken the VT&E, I've passed the VT&E in Wisconsin, so now I am a licensed RVT in California, but I have not done any education, but I have experience, so therefore I am licensed in California. So that's what we're saying is it right? Now they're practicing, they don't need education. Is there consumer harm in that?
Jessica, can you explain that a little bit?
Yeah, I mean, that's, Jessica can probably do a better job of that, but, and one thing I do want to point out, Jessica, though, is that, and I don't want this to get lost in there, and maybe you can explain too, is that we are talking about in the next section, some of the concerns that the stakeholders had about making it easier. So I don't want that to get lost as well.
So, and it goes over it in detail in your memo too, but there's essentially 3 paths to become an RVT. You can, all of them require passing of the national exam. They all have to pass the national exam. They all have to pay their fees. They all have to be background checks. So that's all aside. We're specifically talking about the education component. So they can come in if they have a 2-year accredited degree, that meets that requirement. The board, through regulations, deemed what is equivalent to that 2-year degree. There's 2 sections of law. There's 2068.5, which commonly is referred to as the alternate pathway. And that's a combination of education and experience. And so you have the education, which I think is up to 300 hours of instruction by a school that has oversight through BPPE or a qualified instructor, and 4,416 practice hours that they have to do. So that's one section. The board deemed that equivalent to a 2-year degree. The board also has 2068.6, which they deemed equivalent if they are licensed in another state, passed the VT&E, and did the 4,416 practice hours. That has no education component to it. So there's not a lot of individuals that know this path, but it became very popular around 2020. There were some big corporations that were touting loopholes throughout the United States, California being one of them, saying that if you want to become an RVT and you have this experience, so they're often already in California, they can apply at these 4 other states who don't require education. They in those states, they believe on the job training is equivalent to the education. So they will license them with just the experience. Because of 2068.6, if what's happening is a lot of times they'll get the experience in California, they apply, not leaving the state, they apply to the other state, so they pay their license fees, they take the exam, and by getting licensed in those 4 other states, they now are immediately qualified to then apply in California. So the concern is the requirement to have a license is essentially like an arbitrary requirement, because that's the only, if you get that license, if you pay that license fee, you no longer have to do the education. So it might be a couple $100 license fee in Wisconsin, but then they don't have to pay for $20,000 worth of education because the board in 1989 deemed it already equivalent. And so that's where it's not, it doesn't appear equal to some of the members because they're concerned that there's this, if they go and pay $200 or whatever, I don't know what the license fees are, but hypothetical sake, they don't actually have to have education. And there's others who are paying for the education, and when you have this other path, and the board deemed it equivalent to the education. So that's the concern, is that there's been people who have been licensed for a very long time with no documented consumer harm happening, and who are actively practicing. But at the same time, you have other individuals who are not able to enter the workplace because they can't afford the education.
So there's a path by which a Californian could avoid the educational requirements, get their California practice experience, but get registered by one of the 4 other states. And that's kind of a loophole or an end run that we're concerned about, fair to say, or that some people have raised concerns.
I think the thought is the education requirement is not being applied equally. And so I think the initial conversation was, if we thought that the education component was not required for consumer protection for this group, why then are we requiring it for consumer protection for this group? And I think the conversation was never, education is not important. Everybody agrees education is important, but is it required for consumer protection? I think is the gist of it.
Thank you.
Any other comments, Dr. Maniak?
I mean, the last couple minutes sound like it is a loophole. It is subversion in a way of our regulations in the state. Is there a way that we can exclude the ability to take the VT&E in those 4 states?
I think so if your thought is to close this, what people are calling loophole, which I think can be debatable whether it was a loophole or not. But if you're looking to eliminate that, you would agree with the recommendation to repeal 2068.6.
Any other comments from the board? No. Okay, so we're now going to have a motion.
So you can either hear from the public before you take a motion, or you can take a motion now, and then you have to, after every motion, you have to do public comment. So you could either do it twice, or you can do it once if you have a motion.
Why don't we have a motion now and then take public comments after?
I say we hear from the public first.
So everybody wants to do public comment first? Okay, so we will be doing public comments, but in interest of time, because we do have a lot still to accomplish this afternoon, we will be limiting public comments to 2 minutes. Okay, so we have public comment in the room.
Hi, Grant Miller, Regulatory Director, California Veterinary Medical Association. We have an RVT committee at the CVMA that has discussed these types of topics before. We haven't discussed this particular motion, but we've discussed the concept of the challenges that the RVT profession faces with the patchwork quilt of RVT requirements across the United States. And RVTs universally, at least on our committee, agree that part of the way of building the profession and building it right is to standardize what it means to be an RVT. And because of that and other reasons, we are absolutely in support of repealing section 2068.6. When you talk about finding that happy medium, the happy medium is the alternate pathway, which we created here in California. The CVMA was heavily involved in that, in creating the alternate pathway. Remember that junior college in California is free. Anybody can attend it. So if they would like to work as an assistant and attend night courses at a junior college to get the education, it's important. When you're talking about inducing anesthesia, there needs to be a formal education there to understand respiratory physiology, biochemistry, and other things of that nature. Just simply learning how to do it on the job does not put California's animals at a level of protection that we feel is necessary to hold what the California community would expect us to do. And if this loophole stays open, we can enjoy watching people not go to RVT school and not do the alternate pathway. They will all go to these 4 states and do this, and we will have a very, very different type of education among our RVT profession in the state of California. It
15 seconds.
absolutely lowers the standard of what it means to be an RVT. Is that the step we want? Do we want to take a gigantic step backwards, especially when this board already created the alternate pathway to meet these people in the middle so that they would have a pathway to do this if they didn't have enough money? We
Time.
definitely feel like closing this loophole is important. Thank you.
Okay, there are no more public comments in the room, so moderator, could you please open it up for online?
Absolutely. We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3. And as a reminder to our mobile device users, you may need to hit the ellipses button. That's the ... in order to find your hand. First, we're going to hear from Nancy Elrich. Hold on, or Erlich. Help me out with your name, please. Nancy, we're going to give you 2 minutes to speak, and I'll give you a warning at 1 minute and 15 seconds. 1 minute and then at 15 seconds.
Okay, it's Nancy Ehrlich. I'm with the California RVT Association. I just had an idea that perhaps is a little compromise, that instead of eliminating 2068.6 entirely, it be amended so that California residents can't use it, that the only people who can use it are people from other states. That would probably eliminate most people who are using it, but it would still allow people who are coming from other states to become RVTs in California. That's it.
Thank you. Next, we're going to hear from Michelle Shane. Hold on just a moment. We're sending you a request to unmute your microphone.
I'm from Kentucky, actually going to be talking to you all later in your agenda. But as I'm sitting here listening to your conversation, finding it all very valuable, it occurs to me to ask, how did the prior board determine that on-the-job training was equivalent to education? And has this current board talked about completing another assessment? If a current assessment was taken today, would the same conclusion be reached about equivalency? Thank you.
Thank you. And those are all of our online requests.
All right, thank you. So I guess, do we have a motion on the floor?
You can go for it.
Great, so I can watch it die. Well, I'm gonna make it, see what happens. So I am going to make a motion to approve repealing all regulatory text for CCR Title 16, Section 2068.6. Direct staff to submit the text to the Director of the Department of Consumer Affairs and the Business Consumer Services and Housing Agency for review. And if the board does not receive any comments, providing objections or adverse recommendations specifically directed at the proposed action or to the procedures followed by the board in proposing or adopting the action, then the board authorizes the executive officer to take all steps necessary to initiate the rulemaking process, make any technical or non-substantive changes to the package, and set the matter for hearing if requested. If after the 45-day public comment period, no adverse comments are received and no public hearing is requested, authorize the executive officer to take all steps necessary to complete the rulemaking and repeal the regulation as described in the text notice for CCR Title 16, Section 2068.6.
I don't think your mic was on, but
I'll second the motion.
Okay, any further discussion? No. I would have to say, the comment earlier about the equivalency is something that makes me think about, moving forward with this at this time. Is it something that would kind of put us in a position where we could not make any more like changes, with regards to like how we are, what the requirements for the RVT license. So I am personally kind of in limbo right now of what would I feel like what is in the best interest of the consumers. I have to keep reminding myself that our main mission is for consumer protection, and as we've known, we have had several of these licensees from other states. Do we really have substantial and objective data to support that they have posed a risk for, like consumer protection? Now I'm kind of like thinking.
It's interesting because I think that goes directly to Dr. Bradbury's comment in the beginning in that perception, because I took that comment completely the opposite, in that was said during the second stakeholders meeting where and in the first, it was said several times that education and on-the-job training, it's not all equivalent. And so, and it was a comment that was said several times, and that was probably what got me, because I've been in this field for a very long time, and I could tell you that, I've been around people who would tell me about, where they worked and the experiences that they had. And I would think, wow, I'm lucky, I'm fortunate. And so it's not always the case. So you can't say on-the-job training and education are equivalent. And I think that's where so I took that comment completely the opposite way that you did, in that, how are we judging, or how are we evaluating equivalency?
Any other thoughts, comments? Okay, I guess we're opening the floor for public comment again. Oh, Dr. Sullivan has something to say.
As a public member, not as an MDC member, I trying to find cases of harm, I think, is a false equivalency, because we have a licensed veterinarian that's delegating the task. And if it's the wrong delegation or something goes wrong, that veterinarian is going to take the responsibility, because if they don't, there's going to be two violations: wrong delegation of the task and wrong result. So I don't think we're going to find that, because there's always a veterinarian that is over that RVT that is really assuming the ultimate responsibility. And so there are mistakes being made. We're not seeing them.
Grant Miller, CVMA, and to follow up on Dr. Sullivan's comment, the job of this board to set a minimum standard isn't always necessarily based on a demonstrated harm. It's based on what you all know is best, based on our Practice Act, based on what this board's commitment to consumer protection is. And from my perspective, that seems to increase the pressure on veterinarians every year. But here now you're taking presumably a gigantic step backwards and decreasing that for RVTs. So I don't think demonstrating harm is the only qualification. There's a certain amount of consideration that has to be given to what is the right thing to do to make this profession educated in a way that best serves California consumers. What would California consumers expect? If you look at what RVTs can do as time goes on, they're doing more and more and more in our profession. 2069 allows them to do a number of critical life-saving procedures without any veterinary supervision or involvement at all. SB 669 enables them to now act as an agent of the veterinarian, which means that presumably for certain procedures, only the RVT would interact with the client for regular routine healthcare stuff. So for pets that only get vaccines and parasite control, the only one that they could potentially be seen by is an RVT. That's an increasing role. So I leave you with this. What if there was a state that said that veterinarians didn't need to have a formal education to become a veterinarian? Would we let them in here to practice without a license? Thank you.
Okay, no more public comment in the room. Can we please open it up for online participants?
WebEx is available for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have any additional comments on the new motion. Seeing no request online, do you wish to continue with the motion?
Yes, please. Oh, hold on.
Just as a point of reference, if this would pass and go through the legislature, when would it become in effect?
So to clarify, it's a regulation, so it's not going to go to the legislature. It would go through the Office of Administrative Law, and it depends on when it's submitted to OAL. So they're on a quarterly schedule. So once it's submitted, it would become effective the next quarter.
So that might mean 1 year, 2 years, or?
It could, depending on the rule, because the rulemaking process is very long. And so we would have to put together all the rulemaking paperwork. One thing to keep in mind, part of that justification is the economic and fiscal impact that this would have, both on the board and on the individuals themselves. So removing this is not necessarily an impact on the board itself, but it would have impact on those individuals who will otherwise not have the education. They now have to pay for the education. So that'll be part of that package. It'll go through the normal rulemaking process, which could take up to 2 years.
So it is a heads up for people who want to become RVTs licensed in the state that sooner or later that they would have to undergo the education requirement. Is that correct? You would be given proper notice?
Yes, throughout the rulemaking process, there's multiple opportunities for public comment. The first one being that 45, well, actually the first one being participating in these discussions, the stakeholder meetings we've had, and then the 45-day public comment period for them to voice their concerns as well. That goes out to the public. And so they'll have their opportunity. And then once it becomes effective, we post it on our website, and so we can also do outreach to those individuals, letting them know that this is coming.
So it kind of comes down to standard versus gold standard?
No.
No?
Yeah.
All right, we want to vote?
Yes.
All right, Ms. Pulaski,
Yes.
Dr. Bradbury,
No.
Mr. Espinoza,
Yes.
Dr. Grant,
Yes.
Dr. Maniak,
Yes.
Dr. Solocito.
Yes.
The motion carries.
Agenda item K, proposed direction regarding veterinary technician registration education requirements. While the subcommittee believes education should be a requirement for all RVT applicants, there are concerns related to the educational component to CCR Title 16, Section 2068.5. The subcommittee would like to evaluate this regulation closer to consider decreasing the number of required experiences and/or educational hours, and whether the, and I quote, qualified instructor, unquote, criteria is adequate for consumer protection. There was a short discussion by the committee. I believe that there was a consensus that the qualified instructor needs further work to take care of people circumventing the rules. There was not a consensus on the present course of hours and work required. I think that once the subcommittee comes back with some ideas, the discussion will be more robust. No action required on this item.
I think the subcommittee was just looking for approval from the MDC and the board, which doesn't require an official action, but just a consensus that that's the right direction. They didn't want to spend a lot of time making changes to 2068.5 if you did not want to repeal 2068.6. So as long as everybody is okay with that direction, they will continue.
Any objections? No, I guess.
Is this Dr. Sullivan's last appearance?
Yes.
Thank you, Dr. Sullivan, for all of your
Much,
work.
Dr.
You don't have to get down on
So
your knees. It's
bef-
okay. It's
Before
really
we,
okay.
before we just need to take public comment on item 6, A and F. They didn't have they were just on updates, but we did not have action, but we have to open it up to public comment. So we'll take public comment for 6A and F.
A and F. Okay, so taking public comments for agenda items 6, A and F.
And we also didn't take public comment on that last little bit. Okay.
Yeah, we could do public comment for that too. Yeah. So we're taking public comment for 6A, 6F, and 6K.
Okay, any public comments in the room? We don't have any, so could you please open it up for the online participants, moderator?
We are open for public comment on 6A as in alpha, F as in foxtrot, K as in kilo. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes. Sorry. Okay, so I guess we're moving on to agenda 7, and we have some guests to make a presentation regarding animal chiropractic certification programs.
And we do have 2 presenters from ABCA. We were not able to get presenters for IBCA, but their presentation is linked here. And moderator, if you don't mind promoting them to panelists. And then Justin, if you wouldn't mind sharing your screen for their presentation.
Please call out the names that we're looking for.
Dr. Johnson and Dr. Ziegler.
All right, we've got a couple different profiles for Dr. Johnson.
So for Dr. Johnson, the one we're looking for is Dr. Gerald Johnson.
Speaking.
Okay.
My apologies, I meant to indicate that he was logged in both on a computer and a mobile device.
Oh, got it. All right, moderator, we're not able to see in the room, but do we have both presenters?
Working on it.
Okay, thank you.
All right, we should have Dr. John Ziegler with us.
see me?
Yes, sir. We can see and hear you.
Oh, great. Just testing to make sure you can hear me. This is Dr. Johnson. We're here to present and represent the American Veterinary Chiropractic Association regarding animal chiropractic. We have a presentation to give you guys. I believe Ms. Seiferman is going to kind of roll through the slides for us as we go, and then we'll be happy to answer any questions that you guys have. Is that correct, Ms. Seiferman?
Yes, our team is sharing your slides for you. So as soon as you're ready for the next slide, just indicate and our team will go to the next slide.
Okay. First off, we would like, Dr. Johnson and I would like to thank you for letting us present to you. We also uphold your mission statement to protect consumers and animals with strict educational requirements and professional standards. And so we share in that mission that you have, and the American Veterinary Chiropractic Association is trying to uphold those standards themselves to the physicians, both chiropractic and veterinarian, that take this program and become certified and also are part of our membership. So we'll kind of go through the slides, and again, if the board has any questions or any public comments, we'll be happy to answer them, either myself or Dr. Johnson. We can go to the next slide. Just some credentials. Dr. Johnson, if you want to go ahead and present your credentials, and then I'll present mine behind it. Okay, and I wanted to ask the amount of time that we have for this presentation. Can you hear me?
Yes. We would think between 15-20 minutes to
Okay.
include time for questions.
Okay, very good. I am a doctor of veterinary medicine, University of Florida, graduate 1982. And I think everybody can read on the screen. I'm currently a practicing veterinarian in Spring Hill, Florida at the Silverthorne Animal Clinic, and a member of the AVMA, obviously AVCA, the Society of Therogenology, also the American Association of Acupuncture, as well as an allied member of the International Veterinary Acupuncture Association. So we're here to go over the certification requirements and education that we require in the standard of care to protect the public. John? You'll go on to the second slide, the next slide, please. Dr. John Ziegler, I graduated from Logan University now at Chiropractic College at that time in 2000. Have been practicing chiropractic for 25 years and performing animal chiropractic for the last 15 years. Was certified through the AVCA, served on the board as president, president-elect, president, and immediate past president. I'm currently on the education committee and also on an examiner with the Animal Chiropractic Certification Commission. I was also on the board of Louisiana Board of Chiropractic Examiners for 12 years, served as Secretary Treasurer, President, and past President, as well as on the board of the Chiropractic Association of Louisiana. I've also helped with the National Board of Chiropractic Examiners, both to write there's four national board tests along with the physical therapy portion of it, and I was on the committees to write parts 2, 3, and 4, and also the PT portion, and also was a examiner for the Part 4 national boards from 2015 through 2020. And one of the reasons why I kind of give you that background is because through my experience of helping both write the test and give the test through the chiropractic profession, I feel very confident in the fact that the AVCA standards for their testing and for their certification of the different educational schools is held to as high of a standard as what we see in the chiropractic profession. Of course, you're not going over as wide of a range of topics in education because it's a certification program versus a doctorate program, but
the standards that we utilize when we're giving the certification exam are on par with anything that I've ever been experienced with in other groups. So that's kind of why I just kind of wanted to give you my background also. We'll go on to the next slide. So the American Veterinary Chiropractic Association was started back in 1982. We have the Animal Chiropractic Certification Commission, which we'll go over. We'll kind of determine what our certification is and the difference between a professional certification and like a curriculum certificate. Also, the professional practice analysis, which kind of oversees our examination and holds us to a higher standard. And then what requirements are for through the ACCC and the AVCA for certified doctors, and give you kind of an overview. And we'll go on to the next slide. Again, we're a nonprofit membership. I'm sorry, established in 1989. I said 1989.
1989.
Yeah. We're comprised of licensed doctors of veterinary medicine and licensed doctors of chiropractic. I will tell you one of the really nice things to see about this membership is the fact that we have an annual conference, but we alternate who's the president of the AVCA every 2 years between a veterinarian and a chiropractor. And one of the things that is really nice is the shared respect that each profession has for each other, and also the fact that we come together and work for the betterment of the animals, and a lot of the egos that you may see and protections of the profession are kind of dropped so that we can work together and have a very nice association and hold our doctors to high standards. And so our job is to promote animal chiropractic to professionals and to the public, and we act as a certifying agency. And then of course we have a certification and membership, but they are separate entities. You can become AVCA certified through our testing, but you're not required to join the AVCA membership unless you choose to. We'll go to the next slide. Of course, our certification commission is used to kind of administratively, and it's independent, but it implements the certification program. We look at all the different schools that are trying to provide this education in order to be able to present at the for the licensure or for the certification and the test. And so we review each school that's applying for their ability to teach this material and also to send their students to us. Currently, there are 7 different schools. 5 of them are in the United States. 1 is in Ontario, Canada. Another one is in Germany. But majority of the candidates that come out of the schools probably come from Parker University, which is a chiropractic college in Dallas, Texas, and also from another one that's called ACES, or it's the Animal Chiropractic Education Source. And those 2 schools probably send a majority of the students, but all of them send students to some extent for the testing.
It's Healing Oasis.
Yeah, and Healing Oasis is one also. And we'll go to the next slide. So certification of the voluntary process, by which a non-government entity grants a time-limited recognition and use of credentials to individuals after verifying that he or she has met the predetermined and standardized criteria. Again, this certification is distinct from the licensure in that it's voluntary, and it does require recertification to maintain this credential, and I'll tell you about that in just a minute. The certification in animal chiropractic was based upon input and oversight from both professions, which, as I said, is very refreshing to see. And the certification establishes and promotes professional accountability and visibility, and professional certification is different from a curriculum certificate program. And also in the recertification, we require 30 hours of approved education through the ACCC, which is which kind of regulates the schools, and that's every 3 years. So if someone does not do their continuing ed hours, they are not able to recertify and state that they are certified through the American Veterinary Chiropractic Association. And then each program is usually anywhere from 5 to 6 modules. Some of them, since COVID, have become hybrid a little bit, but they're not fully online. There is, like for instance, at Parker University, 5 of the 6 modules have to be in person, and then there's one where it's anywhere from 12 to 20 hours that you can do online. We'll go ahead and go to the next slide. So there is a difference between professional certification and a curriculum certificate. Of course, you guys can read that, but both of them are, ours is a non-governmental program, and it delivers an assessment based on industry knowledge. It's independent from training courses or course providers. So we do not own these schools that teach it, but we do approve their hours. And it's a time-limited credential. Again, you have to get your continuing ed hours. An examination is not used as a mirror, but it's a screen to separate those who meet the assessment standards from those who do not. And Dr. Gerald has kind of been in charge of the exam. So any questions you want to direct to him would be great. But I will tell you that not everyone passes this exam, and some people have to come back and retake either the written or the practical. And
Well, one thing about the examination is not a high stake exam. It's really to make sure that the candidate has a certain amount of proficient behavior, understand chiropractic adjustments, and will not harm themselves, the pet, or a handler. And so they've met the minimum requirement for the gold standard that we have set up. So it's pretty much a way to make sure that the pet's not going to be hurt and the handler's not going to be hurt, and that the candidate really understands what their purpose is, as far as most of all doing no harm.
Right. And so our primary focus is on the assessment and making sure that like Dr. Johnson said, that they are held to a higher standard. I will also tell you that we are, after listening to the last couple of hours of your board meeting, we are vehemently against anyone going out and doing animal chiropractic on animals who are not held to this kind of standard. We don't want someone taking a weekend course and then thinking that they know how to assess and adjust these animals. The other thing I want to tell you, from your board's perspective, we do not, and we vehemently oppose any chiropractor going out and trying to hold themselves out as a veterinarian. They are to do chiropractic only. They are not to do any break the skin with any needles. They are not to give any kind of diagnosis or anything like that. They are to refer that animal back to the veterinarian. So they are strictly there for chiropractic on the animal, and that is it. And they are not to hold themselves out as a veterinarian in any way, shape, or form. If they are, of course, you guys regulate each state regulates their doctors and everyone around, but there's no support from us on any way, shape, or form for any chiropractor to hold himself out as a veterinarian or to infringe upon the scope of practice for the veterinarian. We're there simply to educate and maintain a high standard for the animal chiropractic, and as Dr. Johnson said, to make sure that the animal's safe, the handler's safe, and the public safe with it. We'll go to the next slide. Professional practice analysis. That's who kind of evaluates our testing standards and makes sure that we're held to the highest testing standards that we can be held to. In prior years, we had Dr. Douglas Lawson and his wife, Maria Lawson. They're out of the Canadian Chiropractic Examining Board and a faculty on the Medicine of Medical Education Research in Canada. Again, their standards were as high as what we have seen through the National Board of Chiropractic Examiners. I was very impressed with how they conducted all the analysis of the test and making sure that it's a fair test, but it's a high stake or high standards test. Currently, we have Dr. David Starmer, who is at Canadian Memorial Chiropractic College, is helping us with this because Dr. Lawson and his wife have, since their due to their age and their health, they've had to retire. And so now we have Dr. David Starmer helping us with this and just making sure that we have a high standard test that's fair, but also will make sure that it ensures that these doctors are educated and not a harm to the public. And so we take a lot of pride in our certification exams and how high our standards are. So again, we want to protect the public and the animals as much as you guys do.
And just to clarify, we require a written test as well as a practical test. So the candidate has to go through both of those processes and are scored on it and given feedback when there's a negative. So it is a two-part examination that we require.
Yes, and most schools, for instance, like when I went through the Parker University one, at the end of the education on the last module, we were given a comprehensive written test over all 6 modules and also a practical exam there that we had to pass before we could even apply to sit for the HCA exam. So the schools themselves are even holding their students to a high standard before they even come to us applying for a certification and applying for that test. And then we'll go to the next slide. So again, this is kind of a summation. Our purpose is to assure the public and the profession that candidates who pass are safe to practice in the field of animal chiropractic. We strive to meet the standards set by the American Psychological Association. Our professional practice analysis exam blueprint is top notch. And then again, current and valid standards provide reliable indicators of competence and safety and for the protection and benefit of the public. And again, as Dr. Johnson said, it consists of a written and practical components. And it's a challenging written test for sure. And the standards set for the practical examination are on par with what I gave when I gave students to Part 4 national boards for chiropractic. And again, we're under continuous review. We're always trying to get better with our exam and with our standards. So I consider it's kind of the gold standard of this niche of the industry. And we're here to help you guys in any way, shape, or form to answer any questions and to and rest assure you that these doctors who are coming out are have had the proper education and are the ability to perform these adjustments without injuring anyone. So that's the other slide. That's the last slide we have, I believe. No, I'm sorry. You can go a couple more. So who are they? There's licensed doctors, and then again the overview. That's who they are, and again the requirements that we receive are our top standards. So any questions that you guys may have for us, and we really appreciate you allowing us to.
And I would like to add that in order to keep up with what the community requires or would like to see from us to get better and better and better, we are obviously involved with trying to have research data published so that we can document the purpose and the usefulness and the success of doing chiropractic adjustments. So we're trying to take it to the next level where we actually have research to support what we do.
Yes, and we are giving out some research grants. We've given several to Canadian Memorial Chiropractic College in 2 years to help them in research regarding the efficiency and efficacy of animal chiropractic. So we are trying to further the research in this area. Do you guys have any questions that Dr. Johnson or I can answer for you?
Okay, thank you. I think we have a few questions. Go ahead, Mr. Espinosa.
And this is for either Dr. Johnson or Dr. Ziegler. What is the level of veterinary supervision required of licensed physical therapists or animal chiropractic care in your jurisdictions?
I'll let Dr. Johnson go first.
Well, the level of, you're asking the restriction. We're not a part of physical therapy, so that I can't respond to. As far as the for chiropractic, the certification process is, as we said, you get educated, and then you hopefully become certified through the AVCA. So that is kind of our gold standard, and that's what our Practice Act requires. So as far as, let's say if a non-veterinarian, a chiropractor, a human chiropractor, it wants to be trained in veterinary or animal chiropractic, they have to demonstrate that they have the knowledge of anatomy of the animals. Most veterinarians have that knowledge, but will then have additional training so that they can do adjustments. So that's kind of what we're putting out here.
And I can answer for my state. So of course, each state in this instance is kind of regulated on the veterinary side by that state's Board of Veterinary Medicine, and then on the chiropractic side by the Board of Chiropractic Medicine. And so each state is individual. Some states have indirect supervision with a referral from the veterinarian. Some states have a direct supervision where, like in Louisiana, I have to have direct supervision by a veterinarian. Some states have it where there is no supervision at all, other than the veterinarian just needs to know that chiropractic is being performed on that animal, and then if there's any complications, to contact that veterinarian immediately. So each state's scope of practice, both on the veterinary side and the chiropractic side, is different in each state.
Right.
And I guess that's kind of the complicated fact of it. So as far as California, you would, it depends on what you want your scope to determine to say about whether it's direct supervision or indirect supervision. Should they have an AVCA certification in order to do this, or can they be, anyone doing it? But as far as in order to obtain the AVCA certification, you must be a doctor of chiropractic in good standing or a doctor of veterinary medicine in good standing in your state in order to perform this, and also to even sit for the examination.
And in
So,
Florida, the non-veterinarian chiropractor that adjusts animals would have to be referred by a veterinarian, or there should be direct, and they leave it loosely as an indirect supervision for chiropractic adjustments being done. So like John is saying, each state has their own scope of their practice laws that require either supervision, non-supervision done with a veterinarian's knowledge, or exactly looking at the adjustment. So it differs.
yeah. Our biggest thing that we're really opposed to is someone who's a non-veterinarian or a non-chiropractic physician going out and performing these adjustments, and they do not have the education to do that. That's our hard line on that. And then our job is to educate each state board and work with them and to help them in any way they need to decide how they want to regulate this in their state. And I think the majority is from a chiropractic standpoint, the majority of the chiropractors who are ABCA certified would prefer it to be indirect supervision, because, I mean, realistically, what veterinarian is going to want to go to a barn at 6 o'clock at night and watch me adjust horses when they could either be in their own practice or at home with their family, and they're just standing there while I adjust. And so, so from a chiropractic standpoint, I would prefer it be indirect, but again, it depends on each state, and as a board, how you decide what kind of regulations you want on these chiropractors would be set up in your own scope of practice. So,
Thank you.
Yeah, my name's Barry Grant. I'm an equine practitioner in California, and appreciate you fellas being on the line for us. I have a couple of questions. When does physical therapy become chiropractic or and vice versa? What are the separations between the two disciplines?
Good question. So and I'll tell you what chiropractic does and what physical therapy does as far as adjusting. In chiropractic school, we learn how to take x-rays, read x-rays, diagnose spinal conditions, and then we work for 3.5 years on adjusting techniques, learning how to palpate and adjust, and from both a biomechanical and a neurological aspect, the spine in order to affect the nervous system. So we're giving an afferent input into the nervous system and getting an efferent result back, whether it's reduction in muscle spasms and bony alignment and inflammation and things such as that. And so we do very specific adjustments, oftentimes based on X-rays. From a physical therapy standpoint, they're mostly educated on everything from musculoskeletal conditions, but in a more of a rehab therapy setting where they're going to be doing more therapies, whether it be interferential, ultrasound, shockwave, rehab exercises, or anything like that. We also learn that in chiropractic school, but we're not able to hold ourselves out as a physical therapist as that. As such, the physical therapists themselves cannot say they do quote unquote chiropractic adjustments. They say they do gross manipulations. The difference is they're more skilled in doing rehab type exercises. We're more skilled in performing spinal adjustments and extremity adjustments on whether it be humans or animals. But they two here in the last 5 or 6 years, they have kind of meshed over. And like I said, I was on the chiropractic board for Louisiana for 12 years. You guys are on this board. You know as well as I know, it depends on who gets to the legislatures and how much money you have to spend in the subcommittees and get it on the floor and get what's voted. The physical therapy profession has more dollars to spend on lobbying efforts than we do as chiropractors, and so they were able about 5 years ago to start doing quote unquote gross manipulations on humans, and that's where the crossover is.
And also understanding the subluxation complex is much more the nucleus of what we do in our adjustments, is finding misalignments in subluxations, adjusting those. And I think in physical therapy is more of, like John said, rehabilitation and using allied pieces of equipment to help rehab a pet more than what we do as far as chiropractors.
Yeah. So I'm not going to be doing water rehab therapy on a horse with a deep digital flexor tendon issue. That would be more your physical therapist doing that than it would be me.
And what are your gentlemen's primary philosophy on being a non-veterinarian who's also licensed in animal chiropractic, whether or not which courses they've taken, but having those people be the primary person to examine a stiff horse for somebody?
From a chiropractic standpoint, when it comes to animals, the veterinarians are the leaders in the health of that animal, and I'm an alternative healthcare that comes in as a adjunct to help the animal from a spinal biomechanical aspect. If there's anything, like for instance, last night I was adjusting a horse, and I told the owner, I said, I think you need to take your horse and go back to your veterinarian and have it x-rayed for kissing spine disease. And so that's not within what I'm trying to do. I'm trying to assess the horse and adjust the horse and get it biomechanically back and also neurologically improved in its function. But when it comes to anything again, dealing with veterinary medicine, the veterinarian takes the lead on that. I'm just an adjunct. I'm not here to take away any of the scope of practice that a veterinarian does. I'm here to assist the veterinarian and do something that honestly the number of veterinarians in the United States who are doing chiropractic versus, licensed veterinarians is, I don't know the number, but I would say it's probably less than 2 to 5% of your profession. So I'm here as an adjunct to help, but not to supplant the veterinarian in their job and what their role is.
And understanding that as a veterinarian is usually in some cases is multimodal, meaning there's several things going on. And, what we're doing as animal chiropractors is that. But as a veterinarian, I have to always keep in mind all the other factors that could come into play. And this is what why the communication between the chiropractors and the veterinarian is so critical, because one is a handshake to the other and vice versa. And to help the pet, you have the opportunity to include adjustments along with other things. As a veterinarian, I do. So it's important to have the two work together.
I'm not recommending any kind of medicines for this horse. That is strictly up to the veterinarian. That is not in scope of my practice, nor is it my place to even do that. So I refer back to the veterinarian for any kind of medicine that needs to be performed.
Okay, so I guess we have another board member. Are you done, Dr. Grant?
Yes, thank you.
Okay, so sorry. So Dr. Bradbury?
Good afternoon. Thank you so much for coming and for sitting through our meeting and our discussions. I do really appreciate your efforts here and how seriously you've taken this endeavor. It's very clear from your presentation, and that's I applaud that. I did wonder for your graduates, the non-veterinary graduates, if in states that don't require a referral, and people can come in off the street, are your graduates being taught, or are they diagnosing these animals? Like, how are they determining whether treatment is appropriate or not if they're a non-veterinarian?
The only thing that we are allowed to diagnose is vertebral subluxations or misalignments of the spine. Beyond that, we are not allowed to make any other or render any other diagnosis. If there's anything else beyond that, they need to be referred back to the veterinarian. The schools teach that, and also we support that in all of our educational materials as to who we are and what we're about. And again, our job is to support the states in each state's individual scope of practice. So we're here to support you guys, not to supplant anything that you're doing. We're here strictly for support and trying to put out a qualified, if it's a non-veterinarian practitioner, and the only other one that would be a chiropractor. We want someone who's qualified to handle the subluxations and the misalignments of the spine and the extremities. But beyond that, we're to refer back. Now, whether a chiropractor does that in a state where they can just bring their horse straight to them and they don't do that, there's no way for us to regulate that. We're an association. We're not a governing body like you are. But it's certainly not coming from our association for anyone to try and hold themselves out as a veterinarian. And it's quite the opposite. We are 100% in support of making sure that person goes back to their veterinarian with this animal to see what else is going on. And I can tell you, as a chiropractor, I refer people back to their veterinarian on a regular basis.
Great. I had one other question, which is just sort of about red flags. So when I was talking to another chiropractor, they had mentioned to me that in their training, they were during their education taught about red flags that would sort of cause them to stop and not do a manipulation and send the patient back to the primary doctor, whoever referred them. Is that part of your curriculum?
It's part of each school's curriculum, yes.
Oh yeah, I forget. It's not your school, but yes, it's part of the requirements in the schools.
Yes, yes.
And we have, even as a veterinarian, I've had neurologists tell me not to adjust this pet with intervertebral disc disease or and those types of infarcts or the spine being crushed or whatever. There are certain times that chiropractic adjustments are contraindicated. And when I refer to a neurologist because the dog's in pain or they're paralyzed and they're dragging their legs behind them, and I send them to the neurologist, they say, sure, you could do this, that, or the other, but do not adjust this dog. I've had some atlanto-occipital malformations that you don't adjust. I've had different species of dogs that are, it's just not a good thing to do to adjust them. And that's why we refer to specialists. Even as a veterinarian, I have to refer to neurologists quite often or getting more advanced diagnostics, whether it's an MRI or CAT scan, what have you. So it is limited in that's our special interest of doing chiropractic adjustments, but we definitely need to recognize, and we do recognize personally, when it's not something that you adjust.
Great, thank you so much.
A lot of the contraindications are things we, as chiropractors, we will see in humans oftentimes. And as we see in humans, oftentimes chiropractors our chiropractic is the last ditch effort before they're euthanizing the animal. So, and oftentimes doctor will say, I'm sorry, I cannot help that animal, and
Okay. Okay, so I guess we're opening it up for public comment, and we do have public comment in the room.
Hello, my name is Grant Miller. I'm a veterinarian. I'm the regulatory director at the California Veterinary Medical Association. Thank you both doctors for being here to give us this presentation. It looks like short of IVCA, your association basically approves all of the other chiropractic training programs in the United States of America. Is that correct?
yes.
So I understand that you might not know the nuances of each one of their training programs, but I certainly know from experience that Options for Animals, at least in the past, was very clear about imparting not only at the beginning of their program, but throughout the program, that chiropractors should work under the direct supervision of a veterinarian. Do you happen to know among your approved program providers what they tell their attendees about supervision?
Go ahead, Doctor.
Well, it goes back to each state has to regulate that. In the schools, though, I look at things a lot differently than a non-veterinarian. So I probably would defer on that answer, but really it's left up to each state. And all the colleges or the programs that submit their request for approval through the AVCA, we overlook or we look at their curriculum, but we really are not there policing exactly what they tell their candidates, their students. But we approve whether it's scientific, it's practical, whether it's research oriented. We approve a certain number of hours that they present to us without being able to be hands-on. And then we are, of course, hoping that they are teaching at the level that would allow their candidates, their students, to be successful in the written and practical examination. And whether they pass or not, they still are able to go and practice chiropractic adjustments, but it's up to each state to determine whether they need referrals or have to have direct supervision or direct observation.
I'm going to jump in real quickly. Just a reminder, we're in public comment phase. It's not for open discussion back and forth. I would just ask the presenters to wait to respond, go through all public comment, and then if the board members wish to have more clarification, then they will request it.
Well, I do have one more question for them. So I'll pose it and then they can wait. So thank you for that answer. And I'm sorry that we got off track from the prescribed method of communication in this forum. But my next question to you was also stemming off of Dr. Bradbury's previous question about red flags. I'm interested in knowing, based on your knowledge of these programs, how much of the program is devoted to identifying red flags. For instance, you were talking about neurologic disease. We actually happen to have one of the foremost leading neurologic specialists on horses in the world sitting on this board, Dr. Barry Grant. For those of you who don't know, he's a surgeon who pioneered a basket or a caging surgery on horses' necks to stabilize a condition called wobblers. And I'm sure that Dr. Grant can tell you that neurologic deficit in horses is very difficult to detect. We actually have board certified neurologists that do nothing but try to decipher that. Horses are exquisitely capable of hiding neurologic disease and also making it only appear on occasion in certain circumstances. So I'm just wondering how much of this education, how much of these approved programs in your association devote to those type of red flag issues, and do they address regional issues such as things like silicosis that only occur in the state of California? Thank you.
Right, there are no more public comments in the room. So moderator, could you please open it up to our online participants? Thank you.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. As a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. First, we're going to hear from Michelle Shane. Hold on just a second. We're sending you a request to unmute your microphone.
Thank you for the opportunity. I just had a couple questions. I don't know when they can provide clarity, but I'm interested to know, there was discussion about not prescribing, but does that include limitations on recommendations for supplements and nutraceuticals? And additionally, would like more information about parallel modalities such as laser, sonics, and rehab, etc., those kinds of things. Thank you.
Thank you. Next, we're going to hear from James Israelson. Hold on just a moment. We're going to send you a request to unmute your microphone. Are you with us, James?
I'm here. Thank you.
Go ahead, please.
Thanks for taking the time to listen to me. I'm a practicing veterinarian in Utah and also an animal chiropractor trained at Options for Animals, which was one of the original programs. And I've been a certified animal chiropractor with AVCA for coming on 20 years now. I think these gentlemen have done a great job presenting the goals of the AVCA. A couple of things that I would stress as well is that, we can't really speak to what the schools are teaching other than that. Certainly my experience with Options for Animals, I think the gentleman brought up that they were talking strongly suggesting that people only, the DCs only adjust with direct supervision. I think that holds back to the time that training was done. At that time, there were almost no states that allowed animal chiropractors to adjust without that supervision. And I think that has evolved significantly. In Utah, there is no supervision required now. The veterinarians here we felt like if we were supposed to be supervising animal chiropractors, but we were not chiropractors ourselves, we didn't want that liability. And it's been that law for a couple of years now. It's working very well. Thank you.
Thank you. Next, we're going to hear from JC. Hold on just a moment. We're sending you a request to unmute your microphone.
The IVCA representative that the vet board could reach out to is Jennifer Henriksen. If they are wanting to hear from the IVCA as well, since it looks like they were not represented today. And then in agreement with what Dr. Israelson said, Robbie from Options for Animals is a good contact, but I do believe they also are in support of certified animal chiropractors without needing the direct supervision. You could reach out to the school directly for that.
Good idea.
Thank you. And those are all of our online requests for public comment.
Okay, well, thank you so much, Dr. Johnson and Dr. Siegler, for coming to our meeting and providing us valuable information. Any other comments from the board members? Okay.
Do you
Do
want
we
me
have
to?
a time to answer Dr. Miller's questions, or?
Yeah, if the board members would like additional information from the presenters, you can ask them at this time.
Was this the question about the red flags in the schools, or was there? Can you repeat the question?
Yes, I think that would be it, Dr. Johnson.
That's what I thought. Yeah, the as far as in school, and also, you know, during the exam preparation, there are certain cases that we kind of throw in those questions, so it's understood that everything's not going to respond to an adjustment, recognizing motion or mobility issues, ambulation problems, and as you pointed out, the neurologic component, and also the response, meaning if we adjust an animal, a single adjustment or two adjustments, and the case is not improving, then we're all taught that we have to refer and do additional diagnostics. So I think that falls in line with the standard of care. Whether you're a veterinarian or non-veterinarian, you understand if your adjustments are not working, you have to refer it, and either back, like John said, back to the veterinarian, and then the veterinarian makes the decision to send it to an allied specialist, a board certified neurologist, for example.
I would also like to add into comments on that. As far as like wobblers is addressed in the schools, it was addressed in my school. And so there are some neurological conditions that are shared, and also doing a neurological exam on the animals is addressed in the schools. However, when he asked about the specific case for the state of California, obviously they're not going to be that detailed in the neurological cases. I would also like to add that in chiropractic, in every chiropractic school, we have a very strong background in spinal anatomy and also neuroanatomy and neurophysiology. And so while we don't have that in animals in chiropractic school, as far as knowing neurology and knowing spinal anatomy, and then when we go into the schools, of course, we get the anatomy through, you know, for horses and canines and such as that. But so most chiropractors are already, through their training for their degree or their diplomate in chiropractic medicine, they're already pretty strong in neurology. And at our annual convention every year, we have speakers come in and discuss neurology and neurophysiology. That's some of the classes that people are able to take. So we're continually trying to educate the doctors that way. And my personal opinion is that's where you're going to see this subspecialty go more and more is towards the neurology of the animal. Because that's where you're seeing chiropractic go, and I think you're going to see that also in animals. The other comment or question was about supplements, nutraceuticals, and other therapies such as laser. As chiropractors, of course, we know we get the average medical doctor gets 3 hours of nutrition in medical school. As chiropractors, we get over 20 to 30 hours in nutrition, and in most chiropractors are very strong in nutrition. However, having said that, all the schools teach that as chiropractors, we are not to give nutritional advice. As a practicing physician, do I have clients ask me these questions? Certainly, but for the most part, I refer them back to their to their veterinarian for any kind of advice on nutrition. And because again, that's not my specialty, and I'm not trying to hold myself out as that. Laser, I have laser in my clinic myself that I use on humans. I'm not using it on animals, but I do have it in my clinic for humans. And at the last ABCA convention, I gave a 1 hour talk on shockwave therapy. So that is something also that chiropractors is becoming more prominent in chiropractic clinics. However, again, we are strictly there for chiropractic. We're not there to be doing shockwave and laser on those animals. And the only way we would be allowed to do it is if you as a board said, we're okay with chiropractors that are certified in animal chiropractic doing these adjunct therapies. But as of right now, no schools are telling them to go out and get a laser and start using it on animals, even though it is presented in these annual conferences and everything like that. But it's presented both for veterinarians and chiropractors.
Right.
A lot of veterinarians are using lasers now.
Okay, we have another question from a board member.
Gentlemen, thank you for presenting today. One quick question. In states in which there is indirect supervision of chiropractors, for non-veterinarian chiropractors, where does the jurisdiction fall if the client has a complaint? Where is the regulation of the standards for those practitioners?
I can answer that as when I was on the board of chiropractic in Louisiana. I'll give you our worst case scenario that we only had two while I was on the board for 12 years. One was a chiropractor that was advertising, and a veterinarian got upset about him advertising animal chiropractic, and so he called the veterinary board. The veterinary board then contacted us at the chiropractic board. We had the doctor come into our board meeting and regulated him over the advertising laws that he was breaking. The second one was we had a doctor who was in Shreveport, Louisiana, which is very close to the Texas line, and he was going over the Texas line and adjusting horses. And the Texas Veterinary Board and the Texas Chiropractic Board alerted us of that. Again, we had him come down to our board meeting and regulated him and fined him. And then I told him if he wanted to do that, he needed to get a Texas chiropractic license and then work within the regulations of the Texas Veterinary Board and the Chiropractic Board. So overall, from what I could tell from our board, I might could send a cease and desist letter out to someone that's practicing out of the scope of our practice or something like that if they're a non-chiropractor, but I could not, like, quote unquote fine them or anything like that. So in our state, most of the time, say it's a chiropractor, even with a medical profession, if they're doing something that has of complaints been filed to the Louisiana Medical Board, the medical board then contacts the Louisiana Board of Chiropractic Examiners and says, hey, you've got this doctor that's doing this procedure. It's out of the scope of his practice and he's infringing upon our scope. We expect you to regulate him. 100% of the time, we bring them into the board meeting. They're on the next board meeting agenda. we immediately tell them to cease and desist on that, and then they come in for their explanation of what they're doing, and they're fined and regulated in that way. And that's how we've handled it in Louisiana.
I think my question was more towards those that are practicing legally, the non-veterinarian chiropractors that are under your association, that are members of your association, that are in states in which there's indirect supervision by veterinarians. Let's say there's a complaint by a client. Who do they complain to?
Well, let me just answer. We'll try to answer that a little bit. And we have had examples of that type of information getting back to the AVCA. Okay, so we have an AVCA certified non-veterinarian that's indirectly being referred to do chiropractic adjustments, and the client is unhappy with that chiropractor or whatever. And so, yes, we do hear about those, but it's very difficult for us to go in and say, hey, we got this complaint against you. You need to cease and desist. It's beyond what we get involved with. We are aware of it because we do hear very, very rarely of a case, and we do advise that that certificate to get legal advice, because that's not what we do also. So it is really beyond what we do as far as regulating or even managing those complaints when they do rarely occur.
And as far as the animals themselves, if a client has a complaint against a doctor who's a non-veterinarian and injured that horse, I would think they would go to the veterinary board first with that complaint and alert the veterinary board what's going on. And then from there, how it's handled depends on each state, how they regulate.
I guess that's all there is.
Thank you.
Okay. All right. Well, again, thank you so much, gentlemen.
Thank you.
For
Thank
coming.
you for allowing us to present. And we hope we've helped in some way.
Okay, so for now, we will take a 5-minute bio break, and then we will resume.
Thank you.
Thank you.
Thank you so much.
Back. And we are going to be discussing agenda number 8. However, we would like to give notice that agenda 9 will be tabled for discussion for tomorrow. So for agenda 8, I would turn it over to Jessica to do the proper introductions.
So members, as you all know, you've heard a lot of requests for the board to consider regulating both physical therapists and animal chiropractors to allow them to practice on animals. Part of that dialogue has been if the boards are going to regulate that should be with their respective boards. So the Board of Chiropractic Examiners and the Physical Therapy Board, not necessarily the Veterinary Medical Board. And so this is just for informational purposes to the board to show how it is working at other state veterinary boards. So you would have the opportunity to hear from them. These boards share the same consumer protection mission that we do and also oversee the veterinarians. And so you could ask questions from them as well. We just felt that this was a good piece of information to bring. So with that, I'll introduce Michelle Shane and Jennifer Pedigo. Thank you so very much for your patience, and especially with Michelle being on the East Coast, being 3 hours ahead of us. Thank you both for waiting and for sticking with us. So with that, I'll turn it over first to Michelle, and then we'll go to Jennifer.
see, I was muted. Jessica, thank you very much for the introduction. I appreciate the opportunity to address the California board on this topic. As Jessica indicated, it is a little late for me. I've got kids in the background, hopefully not bombing the video here, but getting ready for bed. So I did want to go through a presentation, though. I didn't know if that was available.
Yes, moderator, would you mind giving panelist presenter rights to Michelle?
Absolutely. Give me just 1 second here. Michelle, you should have a share button at the very bottom center of your screen.
Super. Give me just 1 moment to get this started. And let's see. Here we are. Okay. Thank you very kindly for the opportunity to share. So this is Kentucky. We're a good-sized state with 120 counties and a lot of voices in each of those individual spaces. I'm just briefly going to talk to you about the composition. So I want you to understand where the Kentucky Board of Veterinary Examiners is coming from in relation to who they represent from the various regions of the state. Talk about recent history of carve-outs from the practice of veterinary medicine in the Commonwealth, look at our recent Practice Act modernization, and then talk about these allied animal health professional permits and recent legislative initiatives. So this is the board composition. We do have an 11-member board, and you'll notice one vacant spot right now, a to be determined permittee that actually represents a new class of folks that are going to be licensed by the board called Allied Animal Health Professionals. But across the board here, we have folks representing large and small animal, equine, and from all regions of the state, east, west, etc. We have one public member, 7 veterinarians, 1 LVT, and then the Kentucky State Veterinarian holds a seat in proxy for our Commissioner of Agriculture, which is an elected position. So we have a great diversity of viewpoints that come to the table. So reproductive specialists back in the late 1980s and 1990s began performing embryo transfers in Kentucky. They had a PhD and felt that they had a right to work on animals because they felt their training allowed them to, regardless of the law restricting this kind of work to veterinarians. After quite a legislative battle, a special exemption was included in our exemption statute, which allowed that a person who holds a postgraduate degree in reproductive psychology or related field within a very small window of 5 years may perform embryo transfers on animals in Kentucky. This was really a carve-out specifically for a handful of people. Now these exempted individuals are getting ready to retire, and they have their clients, the Kentucky Cattlemen's Association and others have already started to petition the board to either open this exemption to any PhD reproductive specialist or provide some sort of permit to allow them to do the work. This is impactful in the area of veterinary shortages, particularly in rural Kentucky, where we have sort of desert service areas because our extension service and others have taught cattlemen and animal production farmers how to do a lot of work themselves. And so the available services that are veterinarians are requested to do keep shrinking. It makes it really hard for a veterinarian to make a living in a certain area. So as more of these services are carved out and done by the owners or done by niche specialists, it's harder and harder to get a veterinarian to come back into these areas because the relationships aren't there. They're only wanted for emergency services, and a veterinarian can't make a living doing only emergency responses and doesn't want to work on those calls only on weekends and nights when other people aren't available. So I did put some references in the presentation with links to our meeting minutes from recent meetings where some of these discussions did happen if you have interest. Another area in Kentucky is our equine dental providers. In Kentucky, they basically worked unchecked by the board for more than 4 decades and are now quite established here. In some very busy parts of the Commonwealth where equine veterinarians had full schedules and didn't want to do the simple work, you know, quote unquote, simple work of equine dentistry, they referred them readily to the EDPs. And it became very common. This was also in conflict, though, with our rural areas where these services were taking away a staple income from veterinarians. And so they began to complain to the board, but little was done during those decades. More recently, in 2019, the board had started receiving a number of calls about animal massage therapy. And in discussions, they decided they wanted nothing to do with licensure of these animal massage therapists, and that should be something that the Animal Massage Therapy Board took care of. So I went with the chairman of the board at the time to a meeting of the Kentucky Board of Licensure for Massage Therapy, or KBLMT. And we spoke with them, and they said, yes, we would love to license animal massage therapists. And they got a group together. The board did participate in some of those stakeholder meetings, but we were not in agreement. And as discussions proceeded and tended to go kind of off track for where veterinarians felt it was appropriate for safety of patients and their clients, they had real hesitation, but a bill was still filed in 2020, and a lot of folks came out of the woodwork, so to speak, that were not part of those stakeholder discussions. Veterinarians protested, and that bill ultimately did fail to the advantage of the Board of Veterinary Examiners. That initiative, though, in 2020, after bill failure, was returned to the primary lobby group for the professional association. And they were supposed to begin stakeholder meetings during the summer of 2020, but COVID hit and all of that fell apart. The board, though, had begun their own Practice Act modernization initiative in 2020 and thought, well, if they're not doing anything with it, and we saw how the talks went related to patient safety, then we should really think about incorporating a mechanism or framework for this type of permit in our own Practice Act. And so that's what they fully explored and ultimately did. And then once we had that framework in place, I'll talk about that in a minute, the Board of Licensure for Massage Therapy with a new composition came in, and we're now talking with them currently about what it would look like to include them in our framework. So our Practice Act, this board was created much later than a lot of other state boards to regulate the practice of veterinary medicine, not till 1942. It didn't have a lot of major updates, and particularly not in the past 35 years or so, and that's where the modernization effort came in. But it added this new credential, the Allied Animal Health Professional, and I'm going to call them from here on out the AAHP. Currently, it is a permit, and I will talk a little bit more about this in another slide, but there is an effort right now to change that to a license for liability insurance purposes. So not to get into too many details on this, but we had a full regulatory or legislative effort, lots of stakeholder meetings and dialogues in order to get our Practice Act modernization over the line, and amazingly did it in a little over 2.5 years. So in the current Practice Act, the modernized version, definition 50 of our definition statutes incorporates this new language underscored and bolded here on your slide, including complementary and alternative veterinary medicine therapies. This was incorporated because we kept getting calls, not just from the massage therapist, but from many other areas, just like you are getting calls on now. And because our definition previously was unclear, we wanted to clarify that these therapies are inclusive of veterinary medicine and a license is required. Unfortunately, definition 50 comes after definition 23, which clarifies that while these are not considered part of conventional veterinary medicine, they actually are part of it. What we're getting now is different professions reading our definition statute, hitting definition number 23, seeing that it's not considered part of veterinary medicine conventionally, and assuming that it must be allowable. If they keep reading to that definition of the practice, they would find it's actually incorporated. So through the legislative effort, we determined that there were two areas that the board would support an AAHP permit for. One of those was animal chiropractic, and we had several years of conversations with the Board of Chiropractors in Kentucky who had no desire at all to pick up a license for anything having to do with animals, and fully supported the board in our efforts to bring that under our umbrella. The other was those equine dental providers who have long been practicing here. But in order to pass our Practice Act modernization bill, we had to remove that to advance the legislation. So basically, this is a credential issued by the board that allows animal chiropractic work on animals within a limited scope of practice. This is the statute here that grants it. We're allowed to do all the business of licensing, collecting fees, and providing administrative regulations. And right now we're in the regulatory process of finalizing our regulations in the public comment period. So currently only for these animal chiropractors. While we were exploring the statutory changes, we did propose hypothetical regulations and governance. So we had an idea of where all this was going. But one of the exceptions the board made at the time was to add this, an AAH permittee to the board to give these permittees a voice. Now, at the time of creation, we were thinking there were only going to be chiropractors, and this sounded like a good deal. But as things are happening very quickly here in Kentucky with the expansion of the AAHP permit, where they're realizing that one permittee is not enough, given that they're only focused on one modality, to represent all of the areas the AAHP permits might be allowed to work in. So we heard from the other organization about the direct and indirect supervision, communication with veterinarians. And in Kentucky, we are allowing them to work independently without the veterinarian supervision, but what we are working on is having required communication with veterinarians, both in advance of services to make sure that there's no existing conditions that might be harmful to the patient if chiropractic is performed, and post services so that the client can and the veterinarian can work together to ensure that the patient is getting the best level of care. So there, we do have a limited scope of practice proposed, prohibitions on the various modalities outside of direct chiropractic manipulation, no medical imaging, no surgery, and no prescription authority. And though our regulations are currently in draft format in the regulatory process, and just our public comment period just closed, the Association of Chiropractors is already pushing for the ability of the ACPs to prescribe nutraceuticals and supplements, and to expand their scope to include all of the prohibitions on laser, shockwave, ultrasound, etc. And their argument is chiropractors have this training, and if they can do it, then they should be able to do it on animals as well as humans. We have record keeping requirements, a duty to report, and subject to compliance and disciplinary action as our other licenses. We do have current and future legislation in Kentucky. Right now, we have a bill filed in our short session just about a week ago for the equine dental providers. We did have the fortune to work with our Veterinary Medical Association and the other stakeholders on this bill. And so everybody right now is in agreement with the bill as it stands. One of the things we did look at was the Texas versus Oklahoma models. And so in the world of equine dental providers in Oklahoma, they landed in a regulatory environment where the license to practice as an equine dental provider is optional. The only time it's required is if you enter a racetrack to work on the racehorses. Otherwise, you can go buy dental equipment and call yourself an equine dental provider and set up shop. In Texas, the license is mandatory, but they have what we call advisory committees to the board. They're not voting, but they do provide insights from the particular practice. Sorry, it's late here. My brain is tired. We do have, they provide advice to the board on decisions related to regulation and disciplinary action. And so we do have the permit changed to a license, as I mentioned, for liability insurance purposes. That's one of their key desires, is to be responsible for themselves and their work. And so rather than holding the veterinarian responsible by providing supervision, they're able to get their own insurance and be liable directly. We also have in our bill an increased framework for the AHP to allow other modalities to come in, strong title protections for these different classes, and as I said, the advisory committee. We're again working with the massage therapists, as I mentioned, with their new board. And when all of this came out in the public arena, the filed regulations, the physical therapists decided that they needed to be involved as well. And so we're starting talks with them. I will say we've already met with the Kentucky Board of Physical Therapy, and both the Physical Therapy Board and the Board of Veterinarians in Kentucky are opposed to allowing a license for physical therapists on animals. So who wants a piece of veterinary medicine? And I throw this in here because these are the various areas that Kentucky has been contacted on. And so I know you've been asked a lot of questions in California as well. But my perspective is if these areas or professions are governed by disparate boards, they're all going to have different ideas about what's acceptable for them to do on animals. Whereas veterinarians have animal training at the forefront of your profession and have the best idea on how to handle scope of practice for each of these. So yeah, keeping veterinarians as your SMEs keeps the practice on animals under a single board's umbrella. It provides consistent limits on the scope of practice. It's certainly less confusing for the consumer public. If they have an animal problem, they go to you instead of trying to figure out where to go. And there's one source for animal service listings. And that is all that I have. Let's see if I can stop my share. Be happy to take any questions now or after Jennifer speaks.
We will have Ms. Pettigo's presentation as well, and then we'll take all the questions later.
Thank you.
I think moderator Ms. Pettigo is still muted.
Hi, I was, yes, sorry. The entire screen changes when you share. So I hope you can see what we got. Perfect. Okay. So I did a little more structural information on how and what our board has found successful just from the inception. So, oh, thank you. We started the licensure for animal chiropractics first in 1999, and then in 2004, it became a license for animal physical therapists. So these are the parallel, I guess, sorry, I'm not controlling the screen, am I? Sorry, it's hard for me to see what's going on, but, or what you guys can see. Oh, okay.
Jen, would you prefer to be the one sharing your screen so you can keep track?
Yeah, I mean, I just if we could just go to the it's up to you. I'm easy either way. There's
Yeah, moderator, would please give Jen the authorization to present her item?
I can hit share again.
Yes, please try share again.
Yep. Perfect. Okay. So I just outlined sort of the basic structure of each of our allied professionals that we do regulate at this time, which includes animal physical therapists, animal chiropractors, and equine dental practitioners. And again, the animal chiropractors started licensure in 1999, 2004 for animal physical therapists, and more recently in 2006, we started licensing equine dental practitioners. Essentially, we're given statutory authority to oversee any alternative veterinary medicine, alternative I highly edited the adoption regulation statute, but it is in full if you want to look at it later, if you click that link. But essentially anything related to acupuncture, chiropractic, dentistry, cosmetic surgery, anything holistic, anything that's an extension of what is considered the practice of veterinary medicine would be under our board, thankfully, because as Ms. Shane said at the end of her presentation, if it concerns an animal, your subject matter experts should be veterinarians. And our legislature has largely never swayed from that. We have a definition of animal chiropractic that outlines their scope of practice. And I think it limits a lot of what the concerns were in terms of some of the extended scope and modalities that Ms. Shane presented, like ultrasound, diagnostic imaging, lasers, things like that. The requirements we have are that they must be a chiropractor for at least 1 year, licensed with the chiropractic board as well. What we do is, or what we found is that anything that wouldn't fall under our scope. So for instance, a lot of the investigations that the chiropractic board undertakes don't necessarily have to do with the animal part of it. It's more to do with advertising or scope of practice transgressing into physical therapy or nutraceuticals. So things like that would not necessarily be covered under our jurisdiction, but if it falls to the type of medicine that the animal chiropractor is practicing, that would go to us. So we have a close relationship, and we found that the subject matter expert in the animal and veterinary component of the care of an animal should be with us, but there are other parts of, chiropractic medicine that we wouldn't necessarily have the authority to act on. So that relationship works really well. We do call out a specific certification with the AVCA, which I believe is currently the only, or a similar organization approved by the board. I won't say that's the only one. It's the only one I can recall at the time, right now. We require a 2-year renewal, 30 hours of continuing education, and then we verify that their license is current, active, and in good standing with the chiropractic board as well. Now, related to supervision, they do have to be referred by a veterinarian who is under a valid BCPR, which in Nevada requires a physical exam by the veterinarian, an in-person physical exam. They assume liability for their own services. So to the questions that were asked about liability, any allied professional in Nevada, whether it is an LVT, a licensed veterinary technician, an animal chiropractor, an animal physical therapist, if it is under their control and it is a decision that they've made, they're still supervised by a veterinarian. So if their medicine was flawed in the referral, or if they missed something, that would be something that would be investigated. But if it is an action done by the animal chiropractor, they would be held responsible because it is their professional judgment that they were using. We do require medical records to be sent to the referring veterinarian within 48 hours. It is indirect supervision or offsite, if you want to call it that. So they are not required to be present during the actual performance of services. And then the medical records must contain patient information, exam findings, diagnosis, plan, progress, etc. And then the disciplinary actions that the board is empowered with are the same for any of our licensees. Fines, suspension, revocation, issue, we can refuse to issue, refuse to renew, probation, etc. So those are all of the components that the board considered and considers to be important elements of that licensure. And it's similar for the physical therapist. The definition scope is a little bit more in depth as well, just goes into a little more specific scope of practice. We are working on updating the scope for animal chiropractors at this time. They do, again, have to be active for at least 1 year as a physical therapist. We require licensure with the physical therapy board, 100 hours of coursework, and then 125 hours of supervised clinical work with a veterinarian. The renewal is biannual. We require 10 hours for that period, and we verify their license. Again, similar supervision. Each practitioner is responsible for their own liability. Medical records must be exchanged. And then there's an outline of what must be contained in those records. And for our equine dental providers, we're a little more specific in the scope of practice. we require a certificate from a professional dentistry organization, which we have one right now, the AEDP or IEDP, a statement from a licensed veterinarian in large animal medicine that verifies they're under direct supervision. So our EDPs do have to be under direct supervision as opposed to physical therapists or chiropractors. EDP assumes liability, same records rules, and the same disciplinary actions have to be or can be taken. So that's the high level. I'd be happy to answer any questions. I know it's late for you guys too, so that is, I will just end it there. And if there's any questions, I'd be happy to answer.
All right, thank you so much, ladies, for the presentation. And I believe we have some questions from the board members, starting with Dr. Bradbury.
Hi, both of you. Thank you so much. Good to see you again. This is Christina Bradbury. I had two questions. One was about the premise permits. Who's responsible for inspections and determining that the premises are okay in each of your states?
Jen, I'll go first if that's okay.
Yeah, please.
We actually, with our Practice Act modernization, just instituted what we call veterinary facility registrations and concurrently the AAHP facility registration. And so in Kentucky, with this initiative, just started to begin the registration and assessment of those facilities in the Commonwealth. We do not have an inspection program set up yet, but that is down the road.
Sorry, my light is doing weird things. Yeah, so we've had facility licensure for a long time. Sorry, Jennifer Pedigo for the record, if that's necessary. But for the premises, we don't necessarily license the facilities for allied professionals, largely because they don't relate to infection control. Although, you know, good question. I like it. Most of the times we don't, we're only inspecting our brick and mortar facilities or mobile clinics. So we don't actually have, as far as I'm aware, protocol specific to allied professionals that either deliver services at the location of the owners. If they are part of a facility, so for instance, we have specialty centers that do offer parallel physical therapy in there. We do inspect those arms of those facilities.
Great, thank you. And then I guess this would be for you, Jennifer, since I think, Michelle, yours hasn't quite gone through. Have you had any complaints?
Complaints just to facilities or in relation to licensure?
No, to the practice of any of these allied health professionals.
So we have had complaints. However, they are related to unlicensed practice. I did do when Ms. Sieverman had asked me to discuss this with you, I did want to get some examples, but largely speaking, unlicensed practice is where we find the most complaints related to animal physical therapists. I know we haven't had any complaints against our EDPs. We have very low numbers. Most of the time, if we have concerns about practitioners, it's just that they're unlicensed or performing body work, which is a big one that we see in large animal. And typically those are practitioners from other states that got certified online and think they can do adjustments. But against actual licensees, we haven't had any.
If I may add, that Kentucky, while our permit is still coming online, we do have cases against individuals where there's been patient harm in equine dental and animal chiropractic.
Great, thank you so much to both of you, and thank you for staying late. Sorry about that.
No problem.
Anybody else has any questions? No, I have a question. May I ask how many licensees of these allied health professionals you guys have currently?
Mine are Yeah,
Yeah,
mine are
okay.
just estimates. We're going to estimate there's going to be about 50 equine dental providers to register. Eventually, with animal chiropractic, the door is wide open. We're not certain. We do know there are practitioners in the state, and we are going to offer, unfortunately, in my opinion, a legacy pathway that's going to allow practitioners that have been in business for a minimum of 10 years and can show tax records as such in this profession to enter without the required training from the ACVA and the ICVA, but I'm not certain on numbers.
So just promise you don't laugh because we only have about 2,100 vets total anyway. We have about 10 animal physical therapists and about 10 animal chiropractors, and we have one whole equine dentist. And most of that is largely because of a resistance to the licensure. So a lot of people either don't practice with a license and we try to find them, or they just avoid us. So that isn't huge numbers, especially by California standards as your neighbor. But we do have outreach, especially for physical therapy. There is a much higher demand that we're trying to work with the profession to try to get in touch with the schools and work with them on opening a pathway to try to actually recruit more people to that for the state of Nevada, at least in animal physical therapy.
All right, thank you for that. Dr. Grant?
What do you do about unlicensed chiropractors and physical therapists from other states coming in or advertising, and they come in to service the citizens of Nevada or Kentucky?
In Kentucky,
Is that
we
a
see that.
problem?
Yeah, in Kentucky a lot with our horse industry. We have a lot of over the border work, folks coming in. We have about 2,700 licensed veterinarians, and about 1,000 of those are out of state because they come in here to work. And so equivalently, we see the unlicensed practice in these various niche professions show up, particularly in the equine world, to do work. We only are enforcing upon report. And so a lot of those in the equine industry are protective of those folks. We don't get the complaints on them, but when we do follow our grievance procedure.
Similar to Ms. Shane, we have any unlicensed practitioner, and we do an investigation. We do based on reporting, typically from industry, because like Ms. Shane referred, those communities tend to be a little more closed to our efforts on licensure. 90% of the time it's resolved with education. Most people that come in think that their weekend online certificate is sufficient to practice. So 90% of those are resolved. In other cases, we've sent cease and desists. In one case about 15 years ago, there was what is it called? I'm sorry, Michelle, I don't have an excuse. It's not that late here. What is it? An injunction. Thank you. We went to a judge and had an injunction, and that eventually curtailed that, but those are rare. Typically it's an education component, but that's the majority of the cases.
Thank you.
Okay, I guess we don't have any more comments from the board members. Now we will be opening it up for public comment. No public comment in the room.
I just wanted to clarify, we did have GV ears here for quite some time, and he was wanting to provide public comment. He did, he is from Animal Physical Therapy Coalition. He brought copies of the public comments for agenda item 8 and agenda item 9C. It looks very similar to what they had provided earlier that all of you were emailed, and also linked on the memo. But I just wanted to say that. And he also brought extra copies for the public, which is back on the back table. He apologizes, but because we went longer, he had to catch a flight. So just letting you all know that he brought copies for all of you.
All right, now we're going to open the public comment to anyone online. Moderator.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. And first, we're going to hear from Karen Atlas. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you so much. My name is Karen Atlas. I'm the president of the Animal Physical Therapy Coalition. The Animal Physical Therapy Coalition represents veterinarians, physical therapists, registered vet technicians, and the animal owning public. We're very interested in the experience of the other states with allied health certifications, and we appreciate the testimony from Kentucky and Nevada boards about regulation in their states. We have submitted letters highlighting the successful utilization of animal physical therapists in Nevada, which is included in the agenda materials. Please note that Nevada has implemented a straightforward, simple, and effective regulatory scheme that protects the welfare of animals, providing not only practice, providing, and the practice has not created any harm to any animals, but it does provide essential rehabilitation care for those animals. In Nevada, animal physical therapy has proven to not only be effective in providing essential access to care, which benefits the animal patients, but also safe in that there have been no disciplinary actions taken against animal physical therapists since its implementation in 2004. We would encourage the California Board to support the adoption of a similar framework authorizing animal physical therapy in this state. Common sense laws are long overdue, and we will stand willing to help in these efforts. Thank you so much.
Thank you. And that was our only online request.
All right, I guess that concludes our session for today. Thank you so much, Ms. Shane and Ms. Pedigo, for all the information that you provided and for being so patient. So we were going to recess and reconvene tomorrow at 9 a.m.
And as a reminder, we have to start with the hearing tomorrow at 9 a.m. We then go into closed session. After closed session, when we reconvene, then we'll go into agenda item 9.